Good morning, everyone. The Committee on Education and the Workforce will come to order. A quorum being present, the committee meets today to consider H.R. 1304, H.R. 1101, and H.R. 1313. Given time constraints, I ask that members insert any written statements into the record. I will hold the record open until the end of the day in order to accommodate those members who may not have prepared written statements. I now recognize myself for an opening statement for today's committee consideration of the three bills. Today, the committee will examine three proposals to help more families access high-quality, affordable health care. For years, Americans across the country have demanded meaningful health care reform and relief from soaring costs. Instead, what they got was a fundamentally flawed law that is collapsing as we speak. Minority Leader Nancy Pelosi recently claimed Obamacare has succeeded in every way possible, but most families would disagree. Obamacare premiums are increasing by double, even triple digits in some states. Millions of families have seen their health care plans canceled. More and more individuals, including many in my home state of North Carolina, are finding they have access to only one insurance provider. Small businesses and their employees would also beg to differ with claims made by the Democrat leader. Obamacare has forced an estimated 10,000 small businesses to close their doors, cost $19 billion in lost wages for small business employees, and destroyed 30,000 small business jobs. And since 2008, 36% of small businesses with fewer than 10 employees have stopped offering coverage. These are the predictable consequences of a government takeover of healthcare that took freedom out of the hands of patients and their doctors, forced individuals to purchase one-size-fits-all health coverage that many do not want or need, and made it harder for small businesses to provide for their employees. This law has failed the American people, and the House Republicans are demanding better. We'll deliver on our promise to repeal Obamacare and replace it with responsible solutions that are patient-centered, not government-driven. While our colleagues on the Energy and Commerce and Ways and Means committees continue their work on this important effort, this committee will as well by advancing free market reforms, particularly relating to employer-provided coverage. Today, we're taking the next step in that process by considering three bills that would empower employers to help workers access affordable health care coverage. As we all know, the majority of Americans obtain health insurance through their employers. But providing employer-sponsored insurance is increasingly difficult in the face of regulatory obstacles and onerous mandates. Still, employers of all sizes are developing creative ways to contain health care costs and promote a healthy workforce. We should do everything we can to foster innovation taking place in the private sector. Unfortunately, misguided federal policies often do more to limit rather than support this promising progress. For example, one of the tools employers have adopted in recent years to provide workers with greater control over their health care dollars is employee wellness programs. There has long been bipartisan support for these popular programs. In fact, one of the only bipartisan provisions of Obamacare allowed employers to discount health insurance premiums for employees who participate in a wellness plan. However, the Obama administration took steps to undermine those plans by issuing restrictive new rules and pursuing litigation against employers. This regulatory confusion and legal uncertainty can have a chilling effect on the ability of employers to reward workers for healthy lifestyle choices. That's why I introduced the Preserving Employee Wellness Programs Act. As Chairman Byrne will soon explain in more detail, this bill will provide employers with the certainty they need to offer wellness programs to their employees. Employers are also facing uncertainty when it comes to self-insured health care plans. With this option, employers have more flexibility to control costs and are able to customize benefits to the unique needs of their workforce. However, in recent years, Democrats in Washington, D.C. signal those plans are just one regulation away from being at risk. Representative Rowe's bill, the Self-Insurance Protection Act, ensures workers and employers can continue to benefit from this cost-effective health plan model. Finally, we will consider legislation that will make it easier and more cost-effective for small businesses to offer health care benefits. The Small Business Health Fairness Act will remove legal roadblocks preventing small businesses from banding together through association health care plans. As a result, this bill will put small business on a more level playing field with labor unions and larger companies. Representative Sam Johnson has championed this important effort for years, which would lead to lower health care costs for small business employees. All three of these proposals reflect a few shared principles. Families should have the freedom to choose the health care plan that meets their needs. Americans need more affordable health care options, not fewer. Health care decisions should rest with patients and their doctors, not government bureaucrats. And instead of prescriptive mandates, we should ensure employers have the tools they need to help their employees afford health care. I want to thank my colleagues, Representatives Rowe, Wahlberg, Byrne, and Johnson, for their leadership on the proposals we will consider today. Thank you, and I now yield to Ranking Member Scott for his opening remarks.
Thank you, Madam Chair. Madam Chair, during this markup, we'll consider three bills that will weaken consumer protections and health coverage and shift costs onto workers. Now, in just a couple of weeks, we'll mark the 8th anniversary of the passage of the Affordable Care Act. 8 years ago, Democrats held more than 200 bipartisan hearings and passed legislation that, while not perfect, has improved health care in this country. Yet, in the last 8 years, in a couple of years leading up to the ACA's passage, all you heard from Republicans were complaints about the process and policy. Now that the Republicans are in charge, all we've seen them do is to undertake a chaotic, secretive process and attempt to advance policies that will leave Americans worse off. Now, while I strongly oppose these bills we're considering today, Madam Chair, I commend you for at least holding legislative hearings on these bills last week and making the text publicly available before this markup so that we will at least have an intelligent chance to deliberate the merits of the policy in accordance with regular order. Unfortunately, our Democratic colleagues on the Ways and Means and Energy and Commerce committees were not given the same courtesy. Today, those committees will be marking up legislation that was literally held under lock and key. This is not the open and honest legislative process owed to the American people. This is a break from regular order, and is even more troubling because those committees are marking up legislation that threatens to strip health care and financial security away from millions of Americans. Now, it's impossible to have a serious health care discussion in this committee while two other committees are simultaneously working to repeal the Affordable Care Act. Now, we're talking about a moving target. The majority wants to repeal and replace the ACA, but so far we don't have any CBO scores on the cost estimates or the coverage estimates in the so-called replacement bill. CBO scores would expose problems with all of these bills, but instead of a CBO scores, all we have are press releases and speaking points. And so now we're considering three bills that in no way build on the progress of the ACA or are in any part of a comprehensive replacement. And we're doing this without the professional analysis that could guide our discussions. And in the last 8 years, Republicans have complained about the law, promising that if they were in charge, they would do something better. We just can't take their word for it. We've got to measure their proposal against the progress we've made in the last 8 years since the ACA was passed. But to think about the gains made under the ACA, I think it's important to remind people about what the situation was before the Affordable Care Act was passed. Costs were going through the roof. People with pre-existing conditions couldn't get insurance, or if they did, it was unaffordable. Women were paying more than men, and each year, millions of people every year were losing their insurance. Now, since the passage of the ACA, the costs have continued to go up, but at the lowest rate in about 50 years. Those with pre-existing conditions can get insurance at the average rate. Women aren't paying more than men, and instead of millions of people losing their insurance each year, 20 million more people have gained insurance since the passage of the Affordable Care Act. Now, the full name of the law is the Patient Protection and Affordable Care Act. there are patient protections, like insurance companies can't cut you off after they've paid a certain amount over your lifetime. We're closing the donut hole. Those young people up to 26 can stay on their parents' policies, and prevention and cancer screenings and annual checkup go with no copays or deductibles. And so we're considering 3 bills today, and it's impossible to ignore the fact that the majority is taking action in other committees to take these benefits away and take away health coverage for millions. And the bills we're marking up today will leave workers worse off. H.R. 1101, the Small Business Health Fairness Act, expands association plans, a 20-year-old, widely discredited idea that segments markets so a few healthy people can pay less, but a lot of older or less healthy people will pay more. In 2000, the Congressional Budget Office did an analysis and found that the proposal would have little effect on increasing health coverage. And in 2003, the Academy of Actuaries characterized the legislation as flawed because it was neither actuarially sound nor did it protect consumers. It's simple arithmetic. Under the ACA, everyone essentially pays the average. But if you've got a system where healthy folks can pay less, then guess what? Everybody else will pay more. And that's what the CBO score would tell us if we'd taken time to get a CBO score. This legislation does nothing but accelerate a race to the bottom for health coverage at the expense of both workers and employees. Now, the H.R. 1304, the Self-Insurance Protection Act, shields stop-loss insurance from certain federal oversight. Now, while this insurance can help self-insured employers mitigate risk, there are questionable implications for both employers and employees, especially when smaller businesses decide to self-insure. What happens if the insurance company goes bankrupt? What happens to all of the claims? Even after last week's legislative hearing, it's unclear how this does anything to help workers get quality health insurance, and there's ambiguity on the impact of bills might have on states' ability to regulate this kind of insurance. H.R. 1313, preserving employee wellness programs, allows workplace wellness programs to circumvent protections of the Americans with Disabilities Act and the Genetic Information Non-Discrimination Act. As our witnesses pointed out last week, this policy gives employers free range to penalize workers who don't want to disclose their medical information or disability through higher health care costs, charging them higher premiums if they do not disclose this information. Consumer and disability rights groups have vocalized strong opposition for this erosion in key civil rights and privacy protections. Sadly, after last week's hearing, instead of making improvements in the discussion draft, we see an introduced version that actually makes things worse. H.R. 1313 allows wellness programs to require health information of dependents as well as employees. This also undermines the ADA safe harbor provision, which allows insurance companies and employers to use data and actuarial models to assess and classify risk. This bill's overbroad language would exempt all employer plans from the ADA, regardless of reasonable accommodation or retaliation protections. Taken together, these bills would do nothing to help insulate American people from the damage of repealing the ACA. Last week, I said that if Republicans could come up with a plan that's better than the ACA, I'd support it. I had my doubts because we had yet to see a plan, and now we have a plan, and it's a bad one. I think Republicans need to go back to the drawing board, or better yet, work with Democrats to actually improve the ACA. If Republicans would let go of their misguided desire to just repeal the ACA, then we could have serious conversations about how to build on its progress. Thank you, Madam Chair, and I yield back.
Thank you, Mr. Scott. I thank you for acknowledging our willingness to go through regular order on this committee. The committee will now proceed to the consideration of the bill H.R. 1304 for amendment. Sorry, Mr. Courtney?
Just actually would like to make a brief comment before we begin the proceedings, if that's okay.
It's a little bit out of order to do that.
Strike the last word? Or? All right, I'll wait till to strike the last word. And
If that's okay, we'll do that as soon as we begin the proceeding. Without objection, the bill will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I will soon recognize Dr. Rowe to offer an amendment in the nature of a substitute. Without objection, the amendment shall be considered as original text and open to amendment at any point. The amendment in the nature of a substitute has already been distributed and is in each of your folders. I now recognize Dr. Rowe for 5 minutes to explain the substitute.
Thank you, Chairwoman Fox. I was proud to introduce this legislation as part of a broader effort to advance free market, patient-centered health care reforms. It's no secret that the cost of health care is a significant challenge for workers and employers. According to Gallup, health care costs topped the list of financial problems facing working families in 2016. Similarly, small businesses cited the same chief concern in a recent National Federation of Independent Business survey. Perhaps the one bright spot in today's uncertain health insurance market is that employers are using innovative strategies to provide affordable health care coverage for workers and their families. One of the ways employers have eased the burden of rising health care costs is through self-insured plans. This is a very popular approach among employers of all sizes. In fact, in 2016, more than 60% of employers offering health care coverage were self-insured. These plans benefit workers and employers in a variety of ways. With a self-insured policy, employers have the flexibility to design a health care plan tailored to the unique needs of workers and their families. For example, a company with a younger workforce may add additional wellness programs related to prenatal care. At the same time, employees are free from restrictive requirements that force them to purchase specific coverage that they may not want or need. Workers and employers also have greater control over their health care dollars. Instead of purchasing a plan from an insurance company, self-insured employers pay their employee health care costs directly. This allows them to retain savings in years with lower claims and pass those savings on to their workers. For these reasons, this cost-effective model is popular among both employers and labor unions. It's also used by some cities, counties, and school districts. In 2014, the executive director of the Columbia Power and Water Systems, a municipality in my home state of Tennessee, testified before the committee on the effectiveness of their self-insured policy. Because of the flexibility of their self-insured policy, this local utility provider was able to keep their workers' deductibles at $200 for an individual and $400 for a family in 2014, far below what families are paying on the collapsing Obamacare exchanges. And eligible retirees and their dependents receive the same benefits as current employees. The witness testified that their self-insured policy allowed them to retain the best possible workforce, increase productivity, and maintain a high level of satisfaction with the plan. There's no doubt that these are high-quality plans that serve as a viable option for workers and employers alike. However, because employers take on greater financial risk with these plans, most also purchase what's known as stop-loss insurance. Stop-loss insurance has never been considered health insurance under federal law. The reason is simple. It's not health insurance. It does not pay medical claims or perform any of the traditional functions of health insurance. What it does is provide a financial backstop to actual health insurance and protect the benefits of workers and their families. Always looking to expand the regulatory state, the previous administration threatened to regulate stop-loss insurance as traditional insurance. Doing so would put workers and employers at risk of losing their self-insured policy. As we know, the last thing workers and employers need right now is to lose access to the health care plan they like because of misguided federal policies. Although we have a new administration that now understands we need more affordable health care options, not fewer. Congress must act to prevent a future administration from restricting self-insured plans. Why? Employers plan years in advance, and they need long-term certainty and stability when it comes to offering affordable health care to their employers. At the same time, working families deserve the peace of mind that they will have the continuity of care and won't be kicked off their plan just like millions of Americans were under Obamacare. The Self-Insurance Protection Act will provide that peace of mind, certainty, and stability while clarifying once and for all that stop-loss insurance is not health insurance and preventing future bureaucratic overreach. The positive reforms will promote more choices and ensure working families can continue to benefit from the popular health care model not just today but for years to come. The substitute amendment I'm offering makes a clarifying change to the underlying bill, and I encourage all of my colleagues to support the substitute, as well as H.R. 1304. And just one last thing, Madam Chairwoman, I use this as the mayor of Johnson City, Tennessee. Every person up here insures risk. You buy car insurance, life insurance, what you can afford. Basically, what we're asking you to do is simply allow these plans to provide a stop loss for them so they can insure their losses. That's all we're doing. I yield back my time.
Thank you, Dr. Rowe. Mr. Courtney, I'd like to recognize you for 5 minutes.
Thank you, Madam Chairwoman.
Thank you
and,
for your
I apologize
cooperation.
for the little kerfluffle there. So, first of all, let me just say that the gentleman from Tennessee, I have the highest respect for, and I think this bill is offered in full sincerity. I would also just say, though, that we're talking about a threat from the prior administration that never materialized, and now we have a new administration where there is no possibility of such a threat. So, in the meantime, in another part of the campus here on Capitol Hill, we have a full-fledged assault on the healthcare system of this country, which, as of this morning, the American Medical Association, the American Hospital Association, and the Catholic Hospital Association have all denounced. And what is baffling to me is why this committee, which in 2009 and 2010 was at the center of writing healthcare policy. We have a health and pension subcommittee, and the members who were around back then recall quite vividly the 26-hour markup, where a whole host of reforms and patient protections, including age 26 coverage, abolishing pre-existing condition exclusions, medical loss ratio, those were written right here in this committee room. And yet the budget resolution, which passed on January 13th, directed that this committee would be basically sidelined in terms of the process for dealing with these issues. So the ranking member's comments about the grotesque process that we're following, that the Congress is following, with no budget scoring in terms of the proposals that are before Ways and Means and Energy and Commerce, in my opinion, has just been further heightened by the fact that this committee, which traditionally has written these types of policies, is being completely sidelined. One of the things that we debated was age rating. Again, we had a vigorous debate in this committee about whether or not to establish full community rating on the health exchanges. In other words, the same rate whether you're 20 years old or you're 64 years old. And we reached a compromise of 3-to-1 age rating. We modified the existing insurance market, which had age rating as high as 6 to 7-to-1, and came up with a compromise of 3-to-1. The bill that they're going to be debating at Ways and Means and Energy and Commerce blows that up, and again expands the bandwidth to 5-to-1 and eliminates the compression that this committee wrote when we worked on the Affordable Care Act. So one of the other groups that's denounced this bill that's being debated in another part of the Hill today, the ARP, again raised the flag about the fact that this change will see basically a skyrocketing of health insurance costs for people 50 to 64. A typical senior seeking coverage through an exchange has a median income of $25,000. Basically, going from 3-to-1 to 5-to-1 is going to add $3,200 for a 64-year-old based on existing actuarial practices. So again, this bill, which I think we have some objection to on this side, again is I think a benign bill ultimately. But in the meantime, what's really happening to people in this country, this committee, again, is just totally been neutered in terms of dealing with its, in my opinion, appropriate legislative role as a committee of cognizance over health policy. So again, I will join the ranking member in opposition to the underlying bill, but I would just say that hopefully, well, for the record at least, note that there was a time when this committee actually was involved in real sort of health decisions that affect people in real time. And again, Madam Chairwoman, I have the letter from ARP, which was issued yesterday, again protesting this expansion of the age rating that's going to increase health insurance costs for people from age 50 to 64, and I ask that it be admitted to the record, and I yield back the balance of my time.
Thank you, Mr. Courtney. Mr. Scott.
Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
Thank you, Madam Chair. Madam Chair, one of the problems with this bill, along with other bills we're considering today, is we appear to be shooting at a moving target. While two other committees are moving to repeal the ACA, it's hard to have a full grasp of what we're considering today, particularly since the replacement legislation was only released a little over a day ago. Now, I'm not opposed to stop-loss insurance on the intent of stop-loss insurance, which indeed can be helpful in shielding employers from unforeseen risk in many circumstances. However, the committee has had little time to deliberate on the specifics of this bill and the impact it might have across the country. It's ambiguous. That could cause an effect of dissuading states that wish to regulate stop-loss or presenting a level of confusion for states as to what to do with the laws they already have on the books. To date, various states have taken action to regulate stop-loss in order to protect both businesses and workers. For example, some states have enacted laws that require a minimum attachment point for stop-loss insurance. Others have restricted the selling of stop-loss insurance to certain small group markets. We should certainly be overly cautious when considering any legislation that regulates the state's rights and ability to take regulatory action on insurance. We have seen for decades that the ERISA exemption and the federal-state combined role and oversight of these issues is often subject to legal disputes and confusion. And while I trust the intent of the legislation not to disrupt any future regulation or even clarification of the states at the federal level, the bill's ambiguity is cause for concern. Madam Chair, there are a lot of things that we need to make sure we don't make worse than they are. But there's some concerns like how do we protect against insolvency for an insurance company? Are there going to be capital requirements for this selling this kind of insurance? But so to protect against insolvency, and then what happens when there's insolvency? Who gets to pay the bill? Does the employer have to pay the bill and the employee stuck with bills they can't pay? We should not try to preempt traditional power of states to regulate insurance in terms of capital requirements or oversight to protect consumers. Who pays, for example, when who do you complain to when there's a non-payment of bills? Usually it's the insurance commission. Now, if the CBO would score this, we could expose all these issues and give us an opportunity to address them. It's obviously reasonable for employers to protect themselves against a catastrophic financial loss, but because these issues have not been addressed and it's a little unclear as to how they would be addressed and the impact on state regulation, I intend to oppose the legislation.
Thank you, Mr. Scott. I believe, Mr. Sablon, you would like to speak for 5 minutes.
I move to strike the last word.
You're recognized for 5 minutes.
Well, thank you, Chairwoman Fox. And I recall what Mr. Courtney was talking about when actually we did spend about 24 to 26 hours in this room working on so many things. And the one thing that what I was very excited about was the protections under the Affordable Care Act included the Northern Mariana Islands and the other insular areas. Unfortunately, in the final rollout of the bill, when it was signed into law for procedural processes, the insular areas were not included. And so I have no amendment to offer because, frankly, the bills under consideration are of little meaning to the people I represent. These three bills nibble around the edges of our national health care policy. But for the people I represent, the problem is not that health care policy needs fine-tuning or fixing around the edges. The problem is that we have been excluded from that national policy almost entirely. When the Affordable Care Act was signed into law, the people of the Northern Marianas did not gain a guarantee of insurance, even if we have a pre-existing condition. We cannot keep our children on our family policy to age 26. Insurance companies can still cut off our treatment when we reach an annual or lifetime limit. Insurers could charge the elderly more than the young. Insurers can charge women more than men. Unlike other Americans, the Affordable Care Act gave us none of these protections, nor were we provided subsidies to pay for insurance if premiums were beyond our means, nor were our poorer citizens given access to care through Medicaid as other Americans. but it never hurts to help, to hope. And I had hopes that the Republican replacement for Obamacare would include the Americans I represent and to include Americans in the insular areas. I had hopes that the Republican replacement would make health care more affordable, more accessible for all Americans as advertised. Unfortunately, the legislation introduced this week is not as advertised. It does not fulfill the president's promise of, I quote, insurance for everyone, end of quote. It makes no mention of the 4 million Americans who live right here in America, just not in a state or the District of Columbia. Once again, the people of the U.S. insular areas are forgotten, overlooked, uncared for, and their lives, because let us not forget that having health care is literally a matter of life and death. Their lives, the lives of the people I represent, are still treated as less important than the lives of other Americans. And that, Madam Chair, is a very sad situation which any replacement of the Affordable Care Act must fix. I yield back the balance of my time.
Thank you very much. Ms. Bonamici, you're recognized.
Thank you very much, Madam Chairwoman, and I move to strike the last word.
You're recognized for 5 minutes.
Thank you very much, and Madam Chairwoman, I join Ranking Member Scott in thanking you for holding a hearing on the bills we're considering today. I very much appreciate that, and I wasn't here when the Affordable Care Act passed. I was in our state legislature at the time, but I do know that the original House bill was posted online for 30 days before the first committee began a markup and more than 100 days before the tri-committees formally introduced their merged bill. And in the House, there were 79 bipartisan hearings and markups before the bill passed. So, Madam Chairwoman, considering the very, very recent release of the majority's proposal to repeal or replace or repair the Affordable Care Act, I can't help but feeling that the legislation this committee is considering today is sort of like looking at how we might remodel part of the kitchen while the other committees are talking about how they're going to tear down the whole house. You know, the Affordable Care Act has provided health care for millions of Americans. About 20 million more people now have insurance coverage. It includes critical consumer protections that allow people like my constituent, Andrea, the freedom of knowing they have coverage regardless of their employment situation. Here's what Andrea wrote. I was stuck in a dead-end job, afraid to quit because I needed the insurance they provided. With Obamacare, I was able to quit my job, went back to school, knowing that I could get coverage through Medicaid expansion. I finished my trade school in 6 months, and within a year of leaving my old job, I had doubled my salary. Now I'm working as a contractor. With Obamacare, I purchased coverage through the marketplace, making me flexible to take new jobs without fear of losing my health care. In my state of Oregon, has embraced Medicaid expansion. We have very successful coordinated care organizations that are providing preventive health care and really making a difference. We must keep people like Andrea in mind as we consider these misguided attempts to repeal the Affordable Care Act. We have to ask whether the approaches we're considering across the Capitol truly increase access and affordability for our constituents. And though I'm opposed to the bills we're marking up today, I hope we can continue working with our colleagues to build upon the successes of the Affordable Care Act rather than tearing down the entire structure. Thank you, Madam Chairwoman, and I yield back the balance of my time.
Thank you very much, Ms. Bonamici. Mr. Polis,
Move to strike the last word.
you're recognized for 5 minutes.
Thank you. The Affordable Care Act is working. After the passage of the Affordable Care Act, I want to tell a little bit about the impact in my home state of Colorado. Even though the national insurance rate has fallen to a historic low of 9%, in my home state, the number of people without insurance has dropped in half to 6.7%. For Colorado children, I'm proud to say the rate is even lower, 2.5%. 20 million Americans have coverage today that wouldn't have insurance without the Affordable Care Act. And I should point out that every single one of those patients that has access to insurance because of the Affordable Care Act helps reduce the cost of insurance for those of us who don't rely upon the exchanges. The cost of uninsured care, namely that hospitals have to treat in an uncompensated manner those without insurance or without Medicaid, is one of the main drivers of healthcare costs for people who buy their own healthcare insurance. After 7 years of railing against the ACA, finally we're getting to see some of the proposals that Republicans have. Of course, we've only had just a little bit more than 24 hours to react to those before the Ways and Means Committee and Energy and Commerce Committee are marking up the alternative. I would point out that our committee, the Education and Workforce Committee, has been left out of the discussion. In 2009, in the 111th Congress, our committee received reconciliation instructions as part of the budget resolution, which serves as the vehicle that passed the ACA. And as the chair lady recalls, we were here until, I think, the wee hours of the morning, perhaps till 4 or 5 in the morning, 6 in the morning. My colleague from Connecticut corrected me, and we were working hard. And that's appropriate because our committee has jurisdiction over health care. And I'll be offering several amendments later on in the day to highlight the fact that our committee has been bypassed, instead is relegated to considering several loosely related pieces of the complementary or replacement legislation. Look, today we sit in this chamber considering 3 niche bills that don't do anything to protect the progress of the Affordable Care Act. They don't do anything to improve or expand coverage. Frankly, these bills are a distraction from the real conversation. This committee has been marginalized with regard to work on the Affordable Care Act. I hope that this committee can give its members on both sides of the aisle the opportunity to participate through the amendment process in helping to improve the health care system of our country. The American Health Care Act would roll back important protections and coverage gains by the Affordable Care Act. It threatens the health and welfare of hundreds of thousands of individuals in Colorado alone, millions across the country. Instead of considering these incremental marginal bills that push more costs onto families and seniors and average Americans, we really need to improve upon the model of health insurance we put in place 6 years ago. Later on, I plan on offering several amendments to these bills, which would truly help create a 21st century healthcare system that recognizes that healthcare is a right, not a privilege. And I yield back the balance of my time.
Thank you, Mr. Polis. Mr. Espiat, you're recognized.
I move to strike the last word.
You're recognized for 5 minutes.
Thank you, Madam Chair, Ranking Member Scott. While this committee spends its time marking up 3 bills aimed at a piecemeal replacement of the Affordable Care Act, I would like to briefly shift focus to a larger picture. Currently, our colleagues in Energy and Commerce and Ways and Means are marking up legislation that is aimed at repealing the ACA. This extremely partisan action seeks to dismantle President Obama's highly successful signature project and attempts to drive a stake through the heart of his historic legacy. This repeal bill, which, by the way, we have not seen a CBO score on yet, is going to end up providing less coverage at a higher cost to middle class, working class, and low-income families. What we do have on this bill is an analysis by the Joint Committee on Taxation. This bill, in fact, it is simply an effort that will bring help only to the young, healthy, and extremely wealthy. The Joint Committee on Taxation provides some information or some light on this, and this nonpartisan analysis found that repealing the taxes in this effort will add over $500 billion to the U.S. deficit. There have been no hearings on this bill. There have been no expert testimony on the impact of this bill with regards to health care costs for families or the quality of coverage that those families will receive. This is not how this issue should be approached. Substantively, this bill is without any substance that benefits millions of Americans from my district and across the country. The Republican proposal would gut federal requirements for essential health benefits, dismantle working Americans' access to insurance, covered abortion, create age-based subsidies, repeal all the ACA taxes, and completely destroy the safety net made stronger by Medicaid expansion, and imposes caps that will force states to ration care. Again, this bill would only help the young, healthy, and extremely healthy in America. This is an effort that has the support of the President and his administration. In a Saturday 2017 interview with the Washington Post, he said his goal was, and I quote, "insurance for everybody." If this bill represents insurance for everybody, then we have quite a different notion of what insurance and everybody is. In the same interview, he said, and I quote again, "there was a philosophy in some circles that if we can't pay for it, you don't get it, and that's not going to happen with us," end of quote. Madam Chair, the introduction of these bills in Energy and Commerce and Ways and means this is happening. Again, this bill only helps the young, healthy, and extremely wealthy. I'd like to take a minute and talk about the importance of Medicaid expansion across the nation, and specifically in my district. In our country, at least 11 million people are going to lose their health insurance coverage as a result of this reckless approach that cripples Medicaid. Not only could 11 million people lose coverage, but the per capita caps included in this proposed legislation will create a real and destructive financial burden for the 70 million or so Americans who rely on Medicaid. In my district alone, over 156,000 individuals could lose their coverage with the repeal of Medicaid expansion. 156,000. Perhaps we should refer to the President's comments in September 2015 when he said, and I quote again, "everybody's got to be covered." This is an un-Republican thing for me to say, he continued. "I'm going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of, much better than they have been taken care of now," end of quote. Let me be clear. They will be not taken care of. This bill is contrary to his own stated goals and an affront to over 156,000 people in my district. Not only are my colleagues attacking the most vulnerable in our country by targeting Medicaid, but they also gutting federal requirements for comprehensive health care and making maternity care far more expensive than it is. Again, this bill only helps the young, healthy, and incredibly wealthy. I yield back the remaining part of my time.
Thank you very much. Mr. Thompson, do you seek recognition?
Thank you, Chairwoman. Chairwoman,
You're recognized for 5 minutes.
thank you, ma'am. Thank you for this markup today, these three bills that we're dealing with. You know, and I'd love to debate the repeal and replacement of the Affordable Care Act with my colleagues if it was germane and appropriate to our business that we're doing here today. But it is not. Why would I want to do that? I would like to do that on behalf of my constituents. And in Pennsylvania, our health insurance premiums have gone up 53% on the average this past year. I'd like to do that on behalf of my constituents who are experiencing deductibles that are so high per family member, measuring in the tens of thousands of dollars when you add the aggregate, and that's just for the year. Our deductible is just what they have to pay for a year to get access to health care if they get sick, many choosing not to pursue care. I'd love to debate it based on this many people that are on Medicaid, medical assistance, and that was the work I did before Congress in nonprofit community health care. And these folks have a hard time finding physicians. They had that before we expanded these roles, and today, because Medicaid only pays 40 to 60 cents on a dollar cost, most physicians, although they're great people and they want to do the right thing, they can only afford to take so many. In fact, there was a study, and I apologize, I don't have it in front of me, but it just impressed me so much when I read it, that an individual on medical assistance, when facing just five specific diagnoses, was more likely and sooner to die just because of their coverage of medical assistance, because of the delays. And so expanding medical assistance is not a solution. Again, that's not germane to today. I would engage in that debate on behalf of all the children who are involved in the Children's Health Insurance Program, CHIP, which I supported the reauthorization of that when that occurred last time around, who were ripped out of CHIP where they had prompt access to care, pediatricians and specialists, and put into medical assistance where they have a hard time finding physicians. I'd love to have the debate because I agree with my good friend from Northern Marianas. I'm shocked to hear that the Democrats pulled our territories out of that plan at the last hour before that bill was signed. And And so I look forward to having that conversation with you, Kalani. But today we're here to talk about three bills, and starting with the Self-Insurance Protection Act. Employer-sponsored insurance is one of the leading ways Americans obtain health care coverage. And the Kaiser Foundation, Family Foundation, more than 150 million Americans are covered by a health benefit plan offered by the employer. And we can argue about whether we should have had jurisdiction or not with what's going on around the hall, down the hall. But the fact is, what we're doing today is important, because most Americans get their access to health insurance through their employers. And unfortunately, providing employer-sponsored insurance is increasingly difficult under the 2010 health care law. And it's led to all the problems I talked about already. And as we do work to repeal the ACA, we must protect access to employer-based self-insurance, because it's an important part of that effort. Our debate should be about how do we provide Americans access to health care that heals and serves all and hurts none. Because what we have today is, it has mixed result. It hurts a lot of people, in addition to those it might have helped, and I think we can do better. In 2016, 61% of all employers offering health care coverage were self-insured. And with this option, employers cover the cost of medical expenses either by directly reimbursing healthcare providers or directly reimbursing employees as claims rise. Employers can either process claims in-house work or use third-party administrators. The bottom line is the Obama administration repeatedly has indicated that they want to regulate stop-loss insurance as health insurance, which would severely restrict access to self-insured plans. And we know how important that is today. And so we must ensure that this administration and future administrations do not limit this popular, affordable health care model. And so I really appreciate, Chairwoman, you're having this markup today on specifically on this first bill, H.R. 1304, and I urge its prompt consideration. Thank you, ma'am.
Thank you, Mr. Thompson. Mr. Takano, do you seek recognition?
Yes, Madam Chair. Thank you. I have an amendment at the desk.
Mr. Thompson, you're recognized.
Madam Chairwoman, I reserve a point of order on the amendment.
Point of order is reserved. The gentleman is recognized for 5 minutes to explain his amendment.
Thank you, Madam Chair. My amendment would add to the bill that it is the sense of Congress that any health insurance reforms should not be considered unless the Congressional Budget Office determines that such reform has lower cost premiums, more affordable out-of-pocket expenses, provides better benefits, and does not increase the number of uninsured. Surely we can all agree that we share these goals. Now, I am skeptical that the Self-Insurance Protection Act meets those criteria. This bill codifies the ability of stop-loss insurance to avoid federal regulations that apply to other group health plans. This would lead to fragmentation in the marketplace and undermine market reforms in the Affordable Care Act. It could also limit states' ability to regulate stop-loss insurance to protect workers and small businesses. Now, just down the hall, there's another bill being marked up that would benefit from my amendment. While we are considering the three bills here this morning, the Energy and Commerce Committee and the Ways and Means Committee are considering a bill to repeal the Affordable Care Act. Now, we've had less than 48 hours to review the bill. There's a lot we do know, but there's just as much that we don't. We know that the bill unveiled Monday night to replace the ACA will cut taxes for the wealthiest people in America. We know that it will eventually eliminate the Medicaid expansion, which is responsible for insuring millions of Americans, including nearly 80,000 individuals in my district alone. We know that the GOP replacement plan shifts costs to seniors and low-income families while restricting women's access to reproductive health. We know that it is a windfall for the healthy and wealthy and a disaster for nearly everyone else. This is what we know about the GOP health care plan. But perhaps more alarming is what we don't know. My Republican colleagues cannot answer two most important questions about their proposal. How much will it cost, and how many people will it cover? No member of Congress should ever be expected to advance a piece of legislation without knowing its impact on the budget and its consequence for the American people and their constituents. And that is especially true about health care, which is quite literally a matter of life and death. As the President recently pointed out, health care policy is complicated. We know. And that's why my amendment is important. It will help ensure policymakers do not move forward with legislation that raises costs for hardworking Americans and denies them access to care. I urge my colleagues to support this amendment and encourage every member of this committee to hold health reform proposals to a high standard that expands access to high-quality, affordable care to as many people as possible. I yield back, Madam Chair.
Thank you, Mr. Takano. Is there any other member who wishes to speak on the amendment? Thank you. Mr. Takano, do you wish to withdraw the amendment?
Yeah, Madam Chair, I do withdraw my amendment at this time.
Thank you very much.
Thank you.
Ms. Bonamici?
Thank you, Madam Chair. I have an amendment at the desk.
Mr. Thompson's recognized.
Madam Chairwoman, I reserve a point of order on the amendment.
Thank you. The clerk will distribute the amendment. Ms. Bonamici, you're recognized for 5 minutes.
Thank you, Madam Chair. I won't take 5 minutes. The amendment I'm offering today would make clear that states maintain the ability to regulate stop-loss insurance. Several states, including my home state of Oregon, have regulations in place to protect consumers, both business owners and employees, when it comes to stop-loss insurance. I'm concerned that the bill before us may preempt those consumer protections and prevent a state from determining how to best regulate the stop-loss insurance being offered within its borders. In 2014, for example, the Oregon legislature passed a bill to lower a restriction on stop-loss insurance for businesses with fewer than 100 employees to those with less than 50. This was a carefully considered, balanced, bipartisan effort that allowed the state's elected representatives to decide what made the most sense for Oregonians. We should make it clear that this bill we're considering will not stop any state from making such a determination, which is why my simple, straightforward amendment requires that nothing in this bill prohibits states from regulating stop-loss insurance. I urge adoption of my amendment and yield back the balance of my time.
Thank you, Ms. Bonamici. I appreciate your concerns, but we know already that nothing in the bill prevents the states from regulating stop-loss insurance. We've long recognized the ability of the states to do that, and the bill does nothing to change that. Do other members seek recognition?
Madam Chair, I'd like to strike last word.
The gentleman's recognized for 5 minutes.
Thank you, Madam Chair. I offer my support to the amendment offered by my colleague from the state of Oregon. It should be no surprise to those of us in the room that health care policy is extremely complicated. As policymakers, it is our job to fully understand the consequences of legislation before we move forward. I have serious concerns with H.R. 11. Oh, I'm sorry. Excuse me. My apologies. I was meant to speak on the next amendment, not the next bill.
Thank you,
I apologize.
Thank you, Mr. Takano.
Madam Chair,
Yes, Mr. Scott, you're
move to
recognized.
strike the last word.
You're recognized for 5 minutes.
Madam Chair, you've indicated that, in your judgment, there's nothing in this bill that prevents state regulation, so we should not oppose the amendment that says nothing in that should be construed to prevent states from regulating stop-loss policies. There seems to be some confusion with the ERISA and other things, and just make it clear that if a state wants to impose solvency requirements, or who gets stuck with unpaid bills, or what happens with consumer protections, what happens in disputes when the insurance company doesn't want to pay, those are the kind of things that a state can regulate, and I think they're very important to allow them. It's not going to be any federal regulation that the states be allowed to do it. So I would hope that we would make it clear, at least if the amendment isn't going to pass, that you make it clear in the record that the legislative intent of this legislation is not to override or stop or prevent or discourage state regulation, that would be clearly part of the legislative record in this hearing. But I would support the amendment in the meanwhile.
Thank you, Mr. Scott. Without objection, the point of order is withdrawn. Does anyone else seek recognition? I would like to call for the vote on Ms. Bonamici's amendment. All those opposed say aye. Excuse me. Here we go. All those in favor say aye. Sorry. All those opposed say no. In the opinion of the chair, the noes have it. The gentlewoman requests a recorded vote pursuant to Rule 13B of the committee and House Rule 11.2H, and as is the committee's practice, further proceedings on this amendment will be postponed. Are there other members seeking recognition?
Madam Chair?
Mr. Polis, you're recognized.
Madam Chair, I have an excellent amendment at the desk.
The clerk will distribute that excellent amendment.
Thank you.
Chairwoman,
Mr. Thompson.
Madam Chairwoman, I have an excellent reserving a point of order, keeping in the spirit with the gentleman from Colorado on the amendment.
The point of order is reserved. The gentleman from Colorado is recognized for 5 minutes to explain his amendment.
Thank you, Madam Chair. The reason that this amendment is so important is it would create a public insurance option in the exchange, something that would go a long way towards making the Affordable Care Act work better. When we hear about some of the problems in the Affordable Care Act, we hear about areas of the country, including areas of my state, where there's only 1 or 2 providers in the exchange. The solution is obvious. It's something that was actually in the committee report of the Affordable Care Act from this very committee in 2009, but was taken out through Senate reconciliation, and that is the public option. The language of my amendment is based on the Choice Act, which I'm proud to support. Was introduced by Representative Schakowsky, which would establish a public option in the insurance market. A public option is simply administered by the government in a nonprofit manner that is an alternative to the private insurance plans. It provides a baseline of competition and choice for everybody in the country, even in areas where there's only 1 provider in the exchange. Essentially, it's a Medicare-like option that all Americans can choose and pay for, subject to the same subsidies that they get for other private plans in the exchange. And it's a provision I fought for hard to include in the Affordable Care Act. I'm proud it was included in our committee mark. President Obama supported a public option. In fact, he argued the public options, quote, often deliver care more cost-effectively by curtailing administrative overhead and securing better prices from providers, end quote. In fact, when the CBO scored the public option, it was estimated it would reduce the deficit by tens of billions of dollars. By passing my amendment today, we can reduce the deficit by over $50 billion. In addition, we can reduce premiums, again, nonpartisan Congressional Budget Office numbers, reduce premiums by 5 to 7%. Save American taxpayers money, save people who are buying insurance money. I feel it's very important to offer this excellent amendment. It's an important part of the conversation of this bill. I would again express my disappointment that our committee was left out of the reconciliation instructions. I understand there might be a germaneness issue on my bill, which I'll speak to in a moment, but I strongly believe that the public option fits into the important conversation that we need to be having about finding ways to provide quality insurance for all Americans. This is one of the many ideas that Democrats like myself are happy to bring to the table to improve the Affordable Care Act. We're excited to have a discussion about health care. I was disappointed that we haven't been able to pass a bill to improve the Affordable Care Act since 2009. This is one of those ideas that has broad support on my side of the aisle. I'm hopeful our committee can pass it and include it in the committee mark. I ask your support for my amendment, and I yield back the balance of my time.
The gentleman yields back. Mr. Thompson, you're recognized.
Thank you, Madam Chairwoman. I make a point of order that the amendment violates Clause 6 of House Rule 16.
I think
Would Mr. Polis like to speak on the motion?
I'll wait for the chair to rule.
Okay. The chair's,
Then there's nothing to talk about.
Okay, I'll speak to it now. I do believe that the amendment meets all the tests of germaneness because it's central to the Affordable Care Act and the work of this committee.
thank you, Mr. Polis, for yielding back. The chair is prepared to rule. Germaneness is construed narrowly in order to support informed consideration of legislation. The chair finds the amendment is beyond the bill's subject matter and goes beyond the jurisdiction of this committee. The amendment is a proposition on a subject and jurisdiction different from that under consideration within the meaning of Clause 7 of Rule 16 of the House Rules. Therefore, the amendment is not germane. The point of order is sustained.
Madam Chair, I respectfully appeal the ruling of the chair.
Madam Chairwoman,
Mr. Thompson.
Madam Chairwoman, I move to table the appeal.
The vote occurs on the motion to table. All those in favor of the motion to table the gentleman's appeal of the ruling of the chair, say aye.
Aye.
All those opposed say no.
No.
In the opinion of the chair, the ayes have it.
Madam Chair, on that I request a recorded vote.
A recorded vote has been requested. The clerk will call the roll.
Mrs. Fox.
Aye.
Mrs. Fox votes aye. Mr. Wilson. Mr. Hunter. Mr. Rowe. Mr. Thompson. Mr. Thompson votes aye. Mr. Wahlberg. Mr. Guthrie. Mr. Rokita. Mr. Barletta. Mr. Messer. Mr. Byrne. Mr. Byrne votes aye. Mr. Bratt. Mr. Bratt votes aye. Mr. Grothman. Mr. Grothman votes aye. Mr. Russell. Ms. Stefanik. Ms. Stefanik votes aye. Mr. Allen. Mr. Allen votes aye. Mr. Lewis.
Aye.
Mr. Lewis votes aye. Mr. Rooney. Mr. Rooney votes aye. Mr. Mitchell. Mr. Mitchell votes aye. Mr. Garrett. Mr. Garrett votes aye. Mr. Smucker. Mr. Smucker votes aye. Mr. Ferguson. Mr. Ferguson votes aye. Mr. Scott. Mr. Scott votes no. Mrs. Davis. Mrs. Davis votes no. Mr. Grijalva. Mr. Grijalva votes no. Mr. Courtney. Mr. Courtney votes no. Ms. Fudge. Ms. Fudge votes no. Mr. Polis. Mr. Polis votes no. Mr. Soblan. Ms. Wilson. Ms. Wilson votes no. Ms. Bonamici. Ms. Bonamici votes no. Mr. Takano. Mr. Takano votes no. Ms. Adams? Ms. Adams votes no. Mr. Desagne? Mr. Desagne votes no. Mr. Norcross? Mr. Norcross votes no. Ms. Blunt Rochester? Ms. Blunt Rochester votes no. Mr. Krishnamurthy? Mr. Krishnamurthy votes no. Ms. Shea Porter? Mr. Espaillat?
How is Mr. Wahlberg recorded?
Mr. Wahlberg is not recorded. Aye. Mr. Wahlberg votes aye.
How's Mr. Guthrie recorded?
Mr. Guthrie,
Vote aye.
Mr. Guthrie votes aye.
Mr. Rokita?
Mr. Rokita votes aye.
Mr. Messer?
Mr. Messer votes aye.
How is Ms. Shea Porter recorded?
Ms. Shea Porter votes no.
How is Mr. Barletta recorded?
Mr. Barletta is not. Mr. Barletta votes aye.
How is Mr. Hunter recorded?
Mr. Hunter is not recorded. Mr. Hunter votes aye.
How is Mr. Russell recorded?
Mr. Russell is not recorded. Mr. Russell votes aye.
How is Mr. Wilson recorded?
Mr. Wilson is not recorded. Mr. Wilson votes aye.
Clerk will report the total.
Madam Chair, there are 21 yeas and 15 nays.
The motion carries. Ms. Bonamici's,
Madam Chair,
yes, Mr.
move to strike the last word.
Mr. Scott, you're recognized for 5 minutes.
Thank you. Madam Chair, as you indicated, the legislative intent of this legislation is actually consistent with this amendment, but if we can get a commitment to make sure that that is made part of the record, that this act does not prevent states from regulating stop-loss policies, that would be extremely helpful in terms of the Bonamici amendment.
Thank you, Mr. Scott. Ms. Bonamici, do you seek recognition?
Thank you, Madam Chairwoman, and I just want to support Ranking Member Scott's suggestion. If we can get a very clear legislative intent statement consistent with what you said in response to my amendment, I would be willing to withdraw my amendment. And that statement would just need to make clear on the record that nothing in this legislation is intended to preempt state regulation of stop-loss insurance.
I want to thank both Ranking Member Scott and Ms. Bonamici. We will make sure in the report language on the bill that that is made very clear.
Thank you, Madam Chair.
Thank you, Madam Chair, and I am willing to withdraw my amendment from a recorded vote at this time.
Thank you. The gentlewoman withdraws her amendment.
Madam Chair,
Mr. Scott, you're recognized.
there's a tradition if someone comes in late that they can be recorded so
Yes,
long
sir.
as they do not change the outcome of the vote. On the last vote, Mr. Espiat was not here, and I would like him recorded on that last amendment.
Yeah,
On the last vote.
absolutely, we want to continue that tradition. So would the gentleman state his vote?
No? Did you vote? No, on the motion was to table the ruling of the chair, excuse me, table the appeal of the ruling of the chair. Thank you.
And the clerk will note that.
Thank you, Madam.
Thank you. The question now occurs on the amendment in the nature of a substitute. All those in favor say aye. Aye. Those opposed, no. The ayes have it, and the amendment is agreed to. If there are no other members wishing to speak on the bill, I now entertain a motion to report the bill and recognize Mr. Wilson.
Madam Chairwoman, I move that the Committee on Education Workforce report the bill H.R. 1304 to the House of Representatives with an amendment and with the recommendation that the amendment be agreed to and the bill as amended do pass.
The question is on favorably reporting the bill. All those in favor signify by saying aye.
Aye.
Those opposed signify by saying no. The ayes appear to have it. The ayes have it, and the motion is agreed to. H.R. 1304 is ordered reported to the House of Representatives. The chair notes for the record that a quorum is present. I now recognize Mr. Wilson.
I ask unanimous consent that staff be authorized to make necessary and technical changes to the bill and pursuant to House Rule 1, Clause 2L. I give notice that all members have the requisite number of days to file additional or minority views.
Without objection, so ordered. The committee will now proceed to the consideration of the bill H.R. 1101 for amendment. Without objection, the bill will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I will soon recognize Mr. Wahlberg to offer an amendment in the nature of a substitute. Without objection, the amendment shall be considered original text and open to amendment at any point. The amendment in the nature of a substitute has already been distributed and is in each of your folders. I now recognize Mr. Wahlberg for 5 minutes to explain the substitute.
Thank you, Chairwoman Fox. I'm proud to co-sponsor this legislation, which includes positive reforms my colleague Sam Johnson has championed for years, and appreciate the opportunity to discuss the bill today. When Obamacare was forced on the American people 7 years ago, small business owners were concerned about how the law would affect their businesses and their workers. Over the years, many of those employers appeared before this committee, and we listened as their concerns over the law turned to stories about its consequences. As one small business owner said back in 2014, and I quote, "The Affordable Care Act is anything but affordable for our company and employees." In 2015, another employer explained, "In addition to the challenges of record-keeping, reporting, and other compliance issues, the looming unknown cost of insuring future employees has made me apprehensive of continuing to expand my business and hire new employees." The sad truth is that small businesses have been hit especially hard by the government takeover of health care. In fact, Obamacare has destroyed an estimated 300,000 small business jobs and forced an estimated 10,000 small businesses to close. Additionally, Obamacare's costs and mandates have resulted in $19 billion in lost wages for small business employees. These stories and statistics are bad enough on their own, but it's also important to understand what they mean for workers' health care, individuals, human beings themselves. With more and more small businesses unable to offer coverage, more and more employees have fewer health care options. It's not that these employers don't want to provide health insurance for their employees, it's that in the current environment, they simply can't afford to do so. While small businesses and their workers are not the only ones who have taken a hit, they have had a harder time mitigating the damage. For instance, large businesses and labor organizations are able to negotiate on behalf of their employees for high-quality health care at more affordable costs. Small businesses do not have the same bargaining power in the health insurance marketplace and are unable to band together to improve their negotiating position. Additionally, by offering a self-insured qualified group health plan under the Employee Retirement Income Security Act, or ERISA, large employers and labor organizations are exempt from a maze of state rules and regulations related to health insurance. Small businesses, on the other hand, don't have that option. And for an employer whose workers reside in different states, finding the right plan can be incredibly difficult. That's why Representative Johnson and I introduced H.R. 1101, the Small Business Health Fairness Act. The bill amends ERISA to allow small businesses to participate in association health plans, also known as AHPs. By banding together through AHPs, smaller employers can increase their bargaining power with insurance providers, putting them on a more level playing field with larger companies and unions. Employers will then be able to purchase high-quality health care coverage at lower costs for their workers. At the same time, the bill includes numerous provisions that will help ensure AHPs are solvent and working families are protected. Small businesses deserve to be treated the same as large corporations and unions when it comes to providing their employees high-quality health care and coverage. This legislation levels the playing field to ensure they are. In the end, it will lower costs for small businesses already facing limited resources, and it will help expand affordable coverage for working families who want to purchase health insurance through their employer. It is exactly the kind of free market, patient-centered reform we promised the American people, and one of many positive common sense solutions that will modernize our nation's health care system. The substitute amendment I am offering makes clarifying changes to the underlying bill. I urge all of my colleagues to support the substitute as well as the underlying legislation and support employees and employers alike to do the best for themselves and their workers. And I yield back the balance of my time.
The gentleman yields back. Does any member seek recognition on the substitute. Mr. Scott, you're recognized.
Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
Thank you, Madam Chair. The legislation we're considering today is certainly in line with Republicans' overall approach to health care. The promise is a scheme that allows for some privileged few to pay a little less while everybody else pays more. Now, this is simple arithmetic. Under the Affordable Care Act, everybody, healthy, less healthy, everybody essentially pays the average rate. But if you've got a system where you let some healthy people form a group and pay less, then guess what? Everybody else has to pay more. That's just simple arithmetic. Just like the bill being marked up today in the Energy and Commerce Committee, the Small Business Health Fairness Act shifts costs onto workers and undermines key consumer protections. H.R. 1101 allows small employer groups and individuals to join together to obtain health insurance through an unregulated association plan. This legislation would segment markets so a few healthy people could pay less, but a lot of older, less healthy people would pay more. This bill would make it easier for associations to cherry-pick small employers with young, healthy workforces. Yes, these small groups with young, healthier workforces might pay a little less, but everybody else who's left behind, older, less healthy small employers in the traditional market, where they would see their employers, their premiums go up. At a hearing last week, we heard witnesses invited by the Republicans complain that working for a small employer should not mean a more expensive insurance. But if we allow this scheme to go forward, where some employees work for small businesses, where some employees working for small business that can't find an association to get into, they will be relegated to the normal market and have higher premiums, while a few people pay less. Now, the sponsor of the bill outlined some problems small businesses have and suggested that they had an easier time before the Affordable Care Act. Let me tell you something. If you had an employee with a chronic illness in a small business, you would be unlikely to get insurance at any price prior to the Affordable Care Act. In 2004, a study from the Urban Institute on health and AHPs in California found that premiums would rise for a majority of small firms and their workers and be quite disruptive for a significant segment of the population. This legislation also exposes small businesses and their workers to huge financial losses. The multiple employer welfare arrangements, or MEWAs, once enjoyed a complete lack of regulation. That experience gives us a glimpse of what might happen when a large plan goes insolvent. In 2002, a MEWA in Indiana became insolvent, had $20 million in unpaid claims, and less than $1 million in assets, leaving 22,000 participants uninsured. Now, what in this bill prevents this from happening again? This legislation also threatens key consumer protections. Under the ACA, health insurance sold through an association to individuals and small employers must now comply with certain consumer protections. This bill does away with those protections. As one witness testified last week, the legislation could mean that workers moved into an association plan could face skimpier coverage that does not cover workers' key health care needs. In 2003, the American Academy of Actuaries categorized the legislation as flawed because it is neither actuarially sound nor does it protect consumers. This bill would do nothing to improve rates of coverage. In fact, when this bill was considered in 2000, the Congressional Budget Office found that the proposal would have little effect on increasing health care coverage. This 20-year-old legislative idea does nothing but accelerate a race to the bottom for health care coverage, both at the expense of both workers and employers. So I urge my colleagues to oppose the legislation.
Thank you, Mr. Scott. Does anyone seek recognition?
I have an amendment at the desk.
Ms. Wilson, this clerk will distribute the amendment. Mr. Thompson, you're recognized.
Madam Chair, I want to raise a point of order on the amendment.
The point of order is reserved. The gentlewoman from Florida is recognized for 5 minutes to explain her amendment.
Madam Chairwoman, My amendment would stress the sense of Congress that any health insurance reform should not be considered unless the Congressional Budget Office determines that such reform is lower cost, is more affordable, provides better coverage. I would like to ask my colleagues, don't we all have constituents that get sick and need health insurance? Yet, if you repeal Obamacare and millions of people are kicked off the insurance rolls, people will suffer. Their families will suffer, and their children will suffer. All of us get sick, some sicker than others. We're all human. We're all God's children. I am sick right now, in fact, but I'm lucky I have health insurance and have access to a doctor and medicine, and so does every member of Congress. This is very, very serious. To repeal the ACA without an adequate replacement plan is outright dangerous, and our constituents will die without access to health care. Instead of moving backward by cutting off access to health care for millions of hardworking Americans in a haphazard effort to decimate the ACA, it would be better if Republicans partnered with Democrats to amend and strengthen the law. Together, we may create something that works even better for all Americans. I yield back the balance of my time.
Thank you, Ms. Wilson. Any other member wish to
Madam Chair.
be recognized? Mr. Garrett, you're recognized for 5 minutes.
Thank you, Madam Chair. I listened to opposition to this Small Business Health Fairness Act, and it stirs so many questions in my mind. Madam Chair, it's my understanding of the Constitution that we're guaranteed a freedom to associate as we choose. It's my understanding that by that same Constitution, we're guaranteed the right to contract with individuals for legal activity. And yet there's an argument against the allowing of individuals who might be held by one common bond, and that is employees of a small business, to associate with people by their own choice, to enter into contracts by their own choice. On the other hand, we hear testimony that suggests that collective insurance would be a good thing so long as everyone is thrown into the same pool so as to mitigate the risk evenly across the entire population of the United States. But that means that we turn a blind eye to institutional associations that provide these very benefits. Will my colleagues across the aisle condemn health insurance plans that are provided through the United Auto Workers Union? Are they bad? Will they condemn collective life insurance programs that are provided through the National Education Association, where people choose to associate with those with similar values and similar characteristics to lower costs for things that they desire? Or will it only be in a circumstance where small businesses seek parity with advantages that exist in large business and in unions and in collectives that we hear this hue and cry against this program? Freedom of choice, freedom to contract, freedom to associate with individuals with whom we have common bonds in order to drive down the costs of items that are not in fact wants but needs, as is the case with health insurance, is not only okay, it is the essence of who we are as Americans. And all this bill does, Madam Chair, is seek to put small businesses and their employees on the same footing as their competitors and their peers who happen to be affiliated with large union or large national business organizations. With that, I'll move that the bill pass.
The gentleman yields back. Ms. Wilson, you're recognized, with the understanding that you were going to withdraw the amendment.
I withdraw the amendment.
Thank you, Ms. Wilson. Mr. Scott, you're recognized.
Madam Chair, I have an amendment at the desk.
The clerk will distribute the amendment.
Madam Chairwoman,
Mr. Thompson, you're recognized.
Madam Chairwoman, I reserve a point of order on the amendment.
The point of order is reserved. Mr. Scott is recognized for 5 minutes to explain his amendment.
Thank you, Madam Chair. Madam Chair, my colleague from Virginia is absolutely right. Everybody pays the same. It's a policy decision we've made so that those who are unfortunate enough to have pre-existing conditions can get insurance at the standard rate. That's the only way it can be done. The underlying legislation expands association plans, a recycled idea from 20 years ago that has been widely discredited, was doing nothing but accelerating a race to the bottom for health coverage at the expense of both workers and employers. In 2000, the Congressional Budget Office found that the proposal would have little effect on increasing health coverage. Researchers have expressed concern that association health plans would lead to market segmentation, where a few healthy people might be better off so long as they stay healthy, while older and less healthy workers and employers will be left out in the cold. In a press release back in 2003, the Academy of Actuaries characterized the legislation as flawed because it is neither actuarially sound nor did it protect consumers. These flaws are still present in the idea today. It's easy to see how association plans could benefit for those who are lucky enough to actually get into the association. The reason is that people want to join the association is because they will be in a pool with younger, healthier people whose healthcare costs are less than average. Of course, no one would form an association for this purpose with people who have above average costs, because it would be cheaper for them to just stay in the insurance pool and pay the average rate. So these association plans with healthier people will always work for those lucky enough to get in. But if you have all these healthy, cheaper people in an association, then that leaves those left behind with higher costs in the small group market. Then the premiums for the small group market go up. It's simple arithmetic. Proposals like this, which allow cherry picking, only serve to make health coverage less affordable and accessible for those who need it the most. As the Main Street Alliance writes, the bill will, quote, leave behind small businesses with older and sicker employees. This amendment simply ensures that legislation cannot go into effect if this is the case. If the CBO ascertained that the bill would drive up premiums in the traditional small group market, then the bill would have no effect. The association can form and exist if the association can form and exist without wreaking havoc to those who aren't lucky enough to get in, then that's fine. And under the amendment, the bill's provisions would go into effect. But if the associations cannot be formed without costs going up for everybody else, then the bill would have no effect. And that's why I've introduced the amendment and yield back the balance of my time.
The gentleman yields back. Would anyone else like to speak on Mr. Scott's amendment? Mr. Scott.
Madam Chair, I understand that you'll be ruling that it's not technically germane, although it would certainly be an improvement on the bill. But based on that anticipated ruling, I'll withdraw the amendment.
You're withdrawing your excellent amendment. Thank you, Mr. Scott. Who seeks recognition? Mr. Norcross, you're recognized.
I have an amendment at the desk.
The clerk will distribute the amendment.
I might add that it's a really excellent amendment.
It's a really excellent amendment. We're going to see how high these accolades can
Madam
go.
Chairwoman.
Mr. Thompson, you're recognized.
Madam Chairwoman, I reserve a point of order on the amendment.
The point of order is reserved. The gentleman, Mr. Norcross, is recognized for 5 minutes to explain his amendment.
Thank you,
It's a
Madam
really
Chair.
excellent amendment.
Thank you, Madam Chairwoman, Ranking Member Scott. The President made a promise to Americans to have better insurance for less money. I think we need to make sure that every Republican repeal plan and every piece of legislation will meet this test. My simple amendment ensures that we in Congress don't allow policies to raise premiums on workers and their families. Very simply, it says if the CBO determines that the premiums of middle-class workers will increase, that this will have no effect. I've had 25 town hall meetings over the course of the last couple of years, and so many of those constituents have shared their real concerns about costs going up. I hear on both sides of the aisle here those very same concerns. We're in agreement on that. I want to make sure we're in agreement on how we can make it even better. We need to focus on making health care more affordable, along with the quality that we all have come to expect. My friends on the other side of the aisle, the goal of this bill is to do just that. And I think we can just do that a little bit better through this amendment. I know no one on this committee wants to raise those rates. This amendment will ensure that this bill does not raise premiums. I believe together we can make health care work better for working families. We can continue to protect those with pre-existing conditions, protect women, and lower the costs. So let's put this to action. Let's put partisan aside and focus on solutions we both can agree to. I hope you will join me in supporting this amendment, which will give Americans peace of mind that their premiums will not go up. And I reserve the balance of my time.
Thank you very much, Congressman Norcross. Is there anyone else who would like to speak? Hearing no further, we're grateful to again recognize the honorable Congressmember from New Jersey, Don Norcross.
I understand that this has been brought up as not germane, and I'd like to withdraw the amendment, but to keep the thought in mind that we're trying not to raise rates and keep the quality there.
Thank you very much for your efforts, Congressman, and without objection, the amendment is withdrawn. Ms. Bonamici.
Thank you. Mr. Chairman, I have an amendment at the desk, an excellent amendment at the desk.
Well, it's hard to match Congressman Norcross's, but go ahead. And the amendment shall be distributed. I recognize the Congressman from Pennsylvania, Congressman Thompson.
Mr. Chairman, I reserve a point of order on the amendment.
Point of order is noted. Ms. Bonamici.
Thank you, Mr. Chairman. The amendment, the excellent amendment I'm offering today, will protect older Americans who might be adversely affected by this bill. My amendment would require that this legislation only take effect if the Congressional Budget Office determines that premiums for older workers will not increase as a result of the bill's enactment. Proponents of the bill argue that association health plans would expand access and drive down costs. Is that the case for the young and the healthy? But what guarantee would older participants have that their costs will go down as well, that they won't be discriminated against? I have concern that this legislation would actually make it more difficult for people who truly need coverage, older Americans, and that they would be losers. And I want to align myself with the comments made by Ranking Member Scott and point out that a 2000 CBO report found that association health plans would have almost no impact in increasing health coverage. So this common sense excellent amendment will provide assurance that all workers will be treated equally regardless of age. I cannot support this legislation if such protections are not provided to older workers, and I hope all of my colleagues share my concern. I urge adoption of my amendment.
Is there any further comment? We continue to recognize Ms. Bonamici.
Thank you, Mr. Chairman. I'm sensing a trend that this amendment will be ruled that is not germane. So I withdraw the amendment, but I do urge all my colleagues to keep in mind everyone, all of their constituents. Many of us are in the sandwich generation where we're taking care of children and parents. We need to consider all of our constituents, young and old, as we consider this bill, other health care reform bills that are happening across the Capitol. Please keep everyone in mind and what our policy changes will mean to them, and I yield back my time and withdraw the amendment.
Without objection, is there any objection? The amendment is withdrawn. Ms. Shea Porter.
Thank you. I have an amendment at the desk.
Please distribute the amendment, and we recognize Congressman Thompson.
Thank you, Chairman. I reserve a point of order on the amendment.
The point of order is received, and we now proceed to Ms. Shea Porter.
Thank you. Like so many of my colleagues and the people I represent in New Hampshire, I am deeply concerned about the Republican health care bill being rushed through the committee process this week Today's markup represents an opportunity for us to try to mitigate some of the harm this bill would inflict on our constituents. Many of you know that my home state of New Hampshire is on the front lines of the heroin, fentanyl, and prescription opioid crisis. Our communities are struggling, and helping people get treatment will be key to turning the tide. As I talk to families, medical professionals, and law enforcement officials in my state, I hear stories that highlight the dramatic impact the ACA's coverage provisions have made improving access to substance use disorder treatment. Thanks to Medicaid expansion, almost 55,000 more people in New Hampshire now have coverage, and I've met people who couldn't be in a recovery facility without it. All in all, since the ACA passed, our state's uninsured rate has been cut in half. The fight against the heroin, fentanyl, and prescription opioid epidemic is multi-pronged, but it rests on a base of widespread access to coverage and care. Now that base of coverage is at risk. In fact, experts at Harvard and NYU estimate that repealing the ACA's coverage provisions would cause about 2.8 million Americans with a substance use disorder to lose some or all of their coverage. Let me repeat that. 2.8 million Americans with a substance use disorder to lose some or all of their coverage. Why are we doing this? Experts in healthcare advocacy groups are saying that millions of Americans could lose coverage because of damaging proposals in this week's House Republican bill, including the working families that now have coverage thanks to the ACA Medicaid expansion, the older Americans who would be hit hardest by the Republican plan's increased costs, and the people suffering from chronic illness who could be driven off their plans by new continuous coverage restrictions. Let's discuss how the ACA also improved access to substance use disorder treatment for people who already have job-based coverage. Thanks to the ACA, employer-sponsored plans now must cover treatment for behavioral health and substance use disorder, just the same as they would cover any other medical service. These parity protections mean insurers must cover treatment for substance use disorder with comparable cost sharing. No more surprises like annual visit limits, higher copays, or frequent pre-authorization requirements and medical necessity reviews. My amendment would defend the gains we have made by ensuring that today's bill would not reduce access to substance use disorder treatment. Let's not pull the rug out from under people who are about to turn their lives around. I urge my colleagues to vote yes on this amendment to make sure Americans with substance use disorders maintain access to life-saving treatment. I reserve the balance of my time.
Thank you, Ms. Shea Porter. Are there any other comments from any other member? Hearing none, I refer back to Ms. Shea Porter.
Sensing the same trend is my understanding, and that this might be considered not germane, so I withdraw the amendment.
Is there any objection? Hearing no objection, the amendment is withdrawn. We now proceed to Congressman Polis of Colorado.
Mr. Chair, I have an incredible amendment at the desk. This is
Please
the number
distribute the
2,
amendment.
drug importation.
Drug importation amendment shall be distributed.
Mr. Chairman.
And I recognize Mr. Thompson of Pennsylvania.
Mr. Chairman, I reserve a point of order on the amendment.
Point of order has been requested. We now proceed with Mr. Polis.
Thank you, Mr. Chair. This amendment will help address a very important issue, the cost of rising drugs in the United States. As a co-sponsor of the Affordable and Safe Prescription Drug Importation Act, which this amendment is based on, it's critical for Americans to have access to drugs at a similar price to they're available in other nations. I mean, this is outrageous what's going on right now. In 2014, the average American spent over $1,000 per person on prescription drugs. The average citizen of Denmark spent $300. That's not because people in Danes are somehow more healthy. It's because they're paying less for the same drugs that we pay more for. In fact, an analysis done in 2015 by Bloomberg found that a specific diabetes pill costs more than double in the United States than Canada, just across the border. Another example, Abilify, used to treat depression, costs $2,852 in the U.S., $546 in Canada. We all heard about the EpiPen, over $400 in the United States, over $40 in Australia. Look, American taxpayers and people getting insurance, we're getting the short end of the stick. Drawing from the plans laid out in the Affordable and Safe Prescription Drug Implementation Act, my amendment would allow the importation of prescription drugs from Canada. Within 2 years, drugs could be imported from other countries in the OECD. That's the Organization for Economic Cooperation and Development. I would point out that this measure has strong bipartisan support in the Senate. 11 out of the 46 votes for it came from Republicans: Senator Boozman, Senator Collins, Senator Cruz, Senator Flake, Senator Grassley, Senator Heller, Senator Kennedy, Senator Lee, Senator McCain, Senator Paul, and Senator Thune all supported this amendment. I think it makes common sense to save taxpayer money that we would be able to pass this amendment. The standards of these countries, we're not talking about developing countries, we're talking about Canada and OECD countries. The standards of these countries are similar to those of the United States, and the amendment contains strong certification requirements to ensure safety and quality for American patients. This amendment would help save billions of dollars for Americans buying insurance, for taxpayers. I think it makes common sense that we could be able to include this in the bill. I would also point out, and I don't often quote the president, President Trump said, quote, that the pharmaceutical industry, quote, gets away with murder, end quote. That's what Trump said. And on that particular issue, I'd like to say he's right. I hope that the committee will join me in supporting this common sense amendment that would go a long way towards addressing health care costs in our country in a deficit-neutral manner, saving Americans money, saving American businesses money, and saving taxpayers money. I urge my colleagues to vote yes, and I yield back the balance of my time.
Thank you, Mr. Polis, and I note for the record that 40 states have actually joined in, including South Carolina, in a lawsuit very similar to what you're trying to attempt. At this time, I recognize Mr. Thompson of Pennsylvania.
Thank you, Mr. Chairman. Well, the gentleman from Colorado raises a very worthy issue of discussion. Unfortunately, it is not germane, and I would suggest, and I make a point of order that the amendment violates Clause 7 of House Rule 16.
Thank you very much. And Mr. Polis?
Mr. Chair, I'll respectfully withdraw the amendment to further the continued bipartisan discussions about how we can advance this important issue.
And is there any further discussion? Hearing none, the amendment is withdrawn.
Mr. Chair, I have an amendment at the desk.
Polis has an amendment. The amendment shall be distributed.
Mr. Chairman.
And we recognize Mr. Thompson.
Mr. Chairman, I reserve a point of order on the amendment.
And point of order is noted. Mr. Polis.
Thank you, Mr. Chair. This amendment is also an important part of improving the Affordable Care Act, and that truly should be the business of this committee, which has jurisdiction over the Affordable Care Act, along with the other committees, the Ways and Means of the Energy and Commerce Committee. Democrats are excited to have this discussion. I'm excited to offer forward the third of 3 ideas today that would help save people money in health care and improve the quality of health care available for Americans. Specifically, Mr. Chair, this amendment would help address the lack of transparency in the health care system. And when we talk about markets and the market failures that occur in health care, the lack of pricing transparency is culprit number 1 in the failure of the free market to address health care costs. Like yourself, Mr. Chair, I'm a fan of the free market. I'm proud to be a capitalist, proud to be supportive of the free market. If we can have pricing transparency in healthcare, that will go a long way towards reining in costs and improving quality. Whether it's prices for prescription drugs, whether it's prices for hospital services, whether it's prices for insurance policies, requiring price disclosure will help patients understand the actual costs of health care. Communicating the various factors that contribute to the high cost of health care is a critical part of constraining health care costs by allowing market-based competition to occur, market-based competition that's stymied today because nobody knows what anything costs and people are charged different amounts for the same thing every single day. I was proud to be here in 2010 when I worked with former Representative Steve Kagan to address this issue by supporting the creation of a transparent and highly competitive medical marketplace by introducing the Transparency in All Healthcare Pricing Act. Unfortunately, that bill was not included in the final version of the Affordable Care Act. What our bill would have done is made sure that any individual or business entity that offers healthcare-related products or services must disclose pricing including on the internet, simply making it available so people can shop. What a simple concept, and what a profound market-based transformation of healthcare could occur as a result of this concept. Unfortunately, it was not included in the final Affordable Care Act. Now that the Energy and Commerce and Ways and Means Committee are marking up the Republican health care proposal, I think it's vital that we revisit this proposal as a market-based mechanism to reduce costs and improve quality. Mr. Chair, I have some remarks from Mr. Kagan in 2009, the 111th Congress, I'd like to enter in the record. And,
Without objection.
Thank you. And in part, what Mr. Kagan argues is that, who's a doctor, I would point out, is that this effort for transparency is, quote, a prescription. And everybody understands that if we all have the same prescription for the same medicine and go to a pharmacy and stand in line, we may all pay different prices for the same prescription our doctor has ordered, end quote. That's magnified even more with regard to medical procedures. If we want competition to work, and if we want markets to work and reduce costs, we need to have a basis for consumers to make that choice. We need more transparency on the quality side, yes, and more transparency on the pricing side, which is what this simple amendment would do with regard to health care in our country. I urge my colleagues to join me in recognizing the jurisdiction of this committee and allowing this amendment to be included in the committee report. I urge a yes vote, and I yield back the balance of my time.
Thank you, Mr. Polis. We now refer to Mr. Thompson.
Mr. Chair, I make a point of order that the amendment violates Clause 7 of House Rule 16, and
Mr. Chairman, if I can be heard on the point of order?
Yes, Mr. Polis.
This amendment not only meets all the tests of germaneness, but it is a critical part of any market-oriented reform to reduce health costs in this country.
Thank you for your input. The chair is prepared to rule. Germaneness is construed narrowly in order to support informed consideration of legislation. The chair finds the amendment is beyond the bill's subject matter. The amendment is a proposition on a subject different from under consideration within the meaning of Clause 7 of Rule 16 of the House Rules. Therefore, the amendment is not germane.
Mr. Chair, I respectfully appeal the ruling of the chair.
Mr. Chairman.
And I recognize Mr. Thompson.
Mr. Chairman, I move to table the appeal.
Yes. And the vote occurs on the motion to table. All in favor of the motion to table, the gentleman's appeal the ruling of the chair say aye.
Aye.
Those opposed, no.
No.
The opinion of the chair is the ayes have it, and the motion
Mr. Chair, on that I
to table
request
is agreed to.
On that I request a recorded vote.
The clerk will call the roll.
Mrs. Fox? Mr. Wilson?
Aye.
Mr. Wilson votes aye. Mr. Hunter? Mr. Rowe? Mr. Thompson? Mr. Thompson votes aye. Mr. Wahlberg? Mr. Wahlberg votes aye. Mr. Guthrie? Mr. Guthrie votes aye. Mr. Rokita? Mr. Barletta? Mr. Messer? Mr. Byrne? Mr. Byrne votes aye. Mr. Bratt? Mr. Bratt votes aye. Mr. Grothman? Mr. Grothman votes aye. Mr. Russell? Ms. Stefanik? Ms. Stefanik votes aye. Mr. Allen? Mr. Allen votes aye. Mr. Lewis? Mr. Rooney? Mr. Rooney votes aye. Mr. Mitchell? Mr. Mitchell votes aye. Mr. Garrett? Mr. Smucker? Mr. Smucker votes aye. Mr. Ferguson? Mr. Ferguson votes aye. Mr. Scott? Mr. Scott votes no. Mrs. Davis? Mrs. Davis votes no. Mr. Grijalva? Mr. Grijalva votes no. Mr. Courtney? Ms. Fudge? Ms. Fudge votes no. Mr. Polis? Mr. Polis votes no. Mr. Sablon? Ms. Wilson? Ms. Wilson votes no. Ms. Bonamici? Ms. Bonamici votes no. Mr. Takano? Ms. Adams? Ms. Adams votes no. Mr. DeSaulnier? Mr. DeSaulnier votes no. Mr. Norcross? Mr. Norcross votes no. Ms. Blunt Rochester? Ms. Blunt Rochester votes no. Mr. Krishnamurthy? Mr. Krishnamurthy votes no. Ms. Shea Porter? Ms. Shea Porter votes no. Mr. Espilot? Mr. Espilot votes no.
Proceed further.
Mrs. Fox? Mr. Hunter? Mr. Hunter votes aye. Mr. Rowe? Mr. Rokita? Mr. Rokita votes aye. Mr. Barletta? Mr. Barletta votes aye. Mr. Messer? Mr. Russell? Mr. Lewis? Mr. Garrett?
Aye.
Mr. Garrett votes aye. Mr. Courtney? Mr. Sablon? Mr. Takano? Sorry.
How's Mr. Messer from Indiana recorded?
Mr. Messer is not recorded. Mr. Messer votes aye.
How is Mrs. Fox recorded?
Mrs. Fox is not recorded. Mrs. Fox votes aye.
Are there members who wish to change their vote? How is Mr. Rooney recorded?
Mr. Rooney has been recorded as an aye.
The clerk shall report the vote.
Mr. Chairman, there are 19 yeas and 14 nays.
The agreement is, or the amendment is, motion to table is agreed to. The question now occurs, no?
Yes, sorry. Yeah. No, we have one more amendment.
I'm sorry. Ms. Davis is recognized for an amendment.
Thank you very much, Mr. Chairman. Mr. Chairman, we know that this bill is not technically a part of the repeal efforts happening in the Ways and Means and Energy and Commerce Committee today as we speak, but it concerns me that this committee is determined to roll back essential protections created by that law. Lost in all this conversation about constituent decision-making is how far we've come on women's health over the last 7 years. It's easy to forget.
If the gentlelady would yield for one moment, Mr. Thompson, you're recognized.
Thank you, Chairwoman. I reserve a point of order on the amendment.
And we need to distribute the gentlelady's amendment. And point of order is reserved. Thank you, Ms. Davis. Please proceed.
Okay, thank you, Madam Chairwoman. Lost in all this conversation about constituent decision-making is how far we've come on women's health over the last 7 years. It's easy to forget that before health care reform, only 12% of women in the individual market had access to maternity care. Almost 9 million women have gained maternity services under health care reform, and that means healthier moms and healthier babies. Many women did not have access to preventative health services, and today, more than 50 million women do. And there was no guaranteed direct access to OBGYN care without referrals. For many women, OBGYN is the only doctor that they regularly see, and the direct access requirement is essential to women getting quality health care. Madam Chairwoman, we know from our own hearing the other day that these provisions are extremely popular. Both the witnesses from Democratic and Republican staffs suggested that these minimum essential benefits should continue to be offered. So that's why I'm so concerned that the bill before us could allow association health plans to be offered that do not offer some of these essential benefits and protections for women. Let's remember, it's International Women's Day today. It seems ironic that we're considering legislation that could set back women's health. My colleagues insist that expanding unregulated association health plans is about choice. I can tell you, I am all about expanding choices in health care coverage, but not if it means giving plans the choice to charge women more for the services they need. We've made this bill, this amendment, actually quite simple. It goes to the intent of the bill. And the intent basically says that reductions in coverage for maternity care or women's preventative health services or limits to direct access to OBGYN care is not basically the intent of this legislation. This really is an opportunity for all of us to show our seriousness about women's health. Thank you, Madam Chair. I yield back.
Thank you very much. Ms. Bonamici, do you seek recognition?
I would like to speak in favor of the amendment.
The gentlewoman's recognized for 5 minutes.
Thank you very much, Madam Chairwoman. And I want to support the amendment offered by Ms. Davis, especially today on Women's Day. And I want to ask my colleagues on both sides of the aisle to use something that is sometimes in short supply here in Congress, and that's long-term thinking. Access to women's health care means healthier women, it means healthier mothers, and it means healthier children. And in the long term, we will see then a healthier population. And when we have a healthier population, we have a reduction in need for costly services. So this is an important amendment recognizing the need for access for women, which was something that was addressed. We've made progress under the Affordable Care Act. Let's not give up on that progress. Let's support Ms. Davis's amendment and make sure that women have access to maternity care, preventive health services, and that direct access to OBGYN care. And I urge all of my colleagues to use some long-term thinking and support the amendment, and I yield back. Thank you, Madam Chairwoman.
Thank you, Ms. Bonamici. Without objection, the point of order is withdrawn. Are there other members seeking recognition on the amendment? Mr. Scott, you're recognized for 5 minutes.
Thank you, Madam Chair. Madam Chair, as we've said frequently, under the Affordable Care Act, everybody pays the same, men, women, healthy, those with pre-existing conditions, everybody pays the average. This amendment really exposes the real problem with the underlying bill, because if it is not accepted, the associations will be basically free to make women pay more than men. That's because that was the case before the Affordable Care Act. Women, in fact, paid more for insurance than men. If the association can form without many women of childbearing age, they can avoid the very expensive maternity care. In fact, association plans will be the way to avoid maternity care, because associations will be formed with mostly men. Those associations with a disproportionate number of men will pay less. Those stuck in the regular business, small business market with all the women will pay more. If that's not true, then according to the amendment, they can form the associations, no problem. If that is true, and this is a scheme to have women pay more than men and make maternity care unaffordable, then according to the amendment, that should not take place. And we should not allow these association plans to disrupt the small business market by having a healthy, low-cost group withdraw from the pool and leave everybody behind paying more. That is a basic problem with these association plans to begin with, and we should not allow this to take place at least on the issue of maternity care. And I'd hope we'd adopt the amendment, because it really, in fact, one of the witnesses last week indicated that all plans ought to cover maternity care as an essential element, and we should not be able to segment the market so that some pay it and some don't. Yield back.
Thank you, Mr. Scott. The chair recognizes herself. I have the utmost respect for my colleague from Virginia, but that same witness to whom he referred also said, in refuting my colleague from Virginia, that association health care plans cannot cherry pick, must cover everyone in the associations. The associations must have been in existence for a period of time. You cannot form an association simply to cherry pick. So the overwhelming majority of small businesses want to do what's right and provide for all of their employees, and to establish these association health plans in order for them to do so. So the goal is to provide a more level playing field between small businesses and big businesses, so more workers have access to affordable coverage, including female small business employees. And while I do not have the statistics in front of me, I think all of us know that more women are forming small businesses than men, and it is likely that there are more women in these small businesses in our country right now who want this coverage. I have no doubt the sponsor of this amendment means well, but good intentions lead to bad results. And the real problem with Obamacare has been that it's a coercive kind of way to do business in this country, forcing individuals to pay higher health care costs, cover certain benefits they may not want or need. That's part of what has driven health care premiums so high. The American people are looking for a better way on health care, and that's why the underlying bill will help, deliver. Because this amendment would continue the same failed approach to health care that has increased costs for hardworking men and women, I'm going to urge my colleagues to vote no on the amendment, but yes on the underlying legislation. And so I yield back my time. Are there any other members seeking recognition? If none, the question occurs on the amendment. All those in favor say aye. All those opposed say no.
No. Ask for a recorded vote?
The gentlewoman requests before I have a chance to ask for the noes. Let me call for the noes. All those in favor say no. The gentlewoman requests a recorded vote pursuant to Rule 13B of the committee and House Rule 11-2H, and as is the committee's further practice, further proceedings shall be postponed. Are there any other members seeking recognition? We will now suspend activity on this bill so that we can come back and vote on the amendment, and we will move on to the next bill. The committee will now proceed to consideration of H.R. 1313 for amendment. Without objection, the bill will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I will soon recognize Mr. Byrne to offer an amendment in the nature of a substitute. Without objection, the amendment shall be considered original text and open to amendment at any point. The amendment in the nature of a substitute has already been distributed and is in each of your folders. I now recognize Mr. Byrne for 5 minutes to explain the substitute.
Thank you, Madam Chairman. Obamacare has been a disaster for working families. For years, workers have struggled to make ends meet, and small businesses have struggled to keep their doors open due to the law's harmful consequences. From increased costs to limited choices, the flawed 2010 health care law has made it more difficult for employers wanting to provide workers with health care coverage. While Congress is already taking steps to provide relief from the law, it's also our responsibility to implement positive reforms in its place that will lower health care costs, expand affordable coverage, and promote a healthy workforce. That's why we are here today. Encouraging innovation in employer-provided health care coverage is an important part of our health care reform efforts. By finding ways to successfully promote a healthy workforce, we can help lower health care costs for working families. Employee wellness programs do just that. Wellness programs provide employees and their families with various incentives, such as lower health care premiums for making healthy lifestyle choices. The programs reward activities like exercising or maintaining appropriate cholesterol levels that can drive down costs and promote a healthier and more productive workforce. Allison Klausner, an employee benefits expert who recently testified before this committee, described employee wellness programs as a, quote, cornerstone of health care reform, close quote. She also said, quote, not only are these programs important for achieving better health outcomes for employees and their families, they also have the potential to increase employee productivity, improve workforce morale and engagement, and reduce health care spending, close quote. These plans are not only effective, but they are also popular and widely supported by employers and employees alike. A recent survey showed more than 60% of all employers offer their employees the option of enrolling in a wellness program. And this free market health care solution has long received bipartisan support from Congress. In fact, one of the only bipartisan provisions in the 2010 health care law allows employers to discount health insurance premiums up to 50% in some circumstances for employees who voluntarily participate in a wellness program. Unfortunately, in recent years, the Equal Employment Opportunity Commission has worked to undermine these popular and effective wellness programs. The Commission pursued costly litigation against employers and published restrictive rules that created significant regulatory confusion. This is simply not acceptable. If we want to lower health care costs, our policy should encourage, rather than discourage, the adoption of free market solutions. That's why I urge support of the Preserving Employee Wellness Programs Act. H.R. 1313 reasserts the bipartisan intent of Congress to encourage the development of employee wellness programs. Under H.R. 1313, employers will have the legal certainty they need to reward workers for making healthy lifestyle decisions. H.R. 1313 also reaffirms existing law that allows employers to provide responsible incentives for participation in employee wellness programs. By eliminating the red tape surrounding employee wellness plans, Congress can help employers expand access to these popular plans and the benefits they provide for workers. The substitute amendment I am offering makes clear that if a wellness program complies with the non-discrimination standards in the Health Insurance Portability and Accountability Act, then the program will also meet the requirements for wellness programs in the Americans with Disabilities Act and the Genetic Information Non-Discrimination Act. The amendment makes a number of technical changes to the introduced bill so it more accurately reflects congressional intent to facilitate these programs. By empowering employers to adopt employee wellness programs, we can take a positive step towards lowering health care costs and promoting a healthy workforce. I'd like to thank Chairwoman Fox for her leadership on this important legislation and strongly urge my colleagues to support the Preserving Employee Wellness Programs Act. Through our support of H.R. 1313 and other positive reforms, Congress can provide Americans with a patient-centered health care system that delivers more choices, lower costs, and greater control for working families. And I yield back.
Thank you, Mr. Byrne. Does any member seek recognition on the substitute? Mr. Scott.
Madam Chair, I move to strike the last word.
You're recognized for 5 minutes.
Thank you. Madam Chair, H.R. 1313, the Preserving Employee Wellness Programs Act, opens the door for unscrupulous employers to misuse the information provided to them through the workplace wellness programs and exposes employees to illegal discrimination. Now, Madam Chair, I support innovations in healthcare and evidence-based wellness programs. I'm concerned, however, that H.R. 1313 would force the divulgence of sensitive information protected under the Americans with Disabilities Act and the Genetic Information Non-Discrimination Act. This information is under the threat of penalty of up to 50% of the cost of health care covered plan. Essentially, H.R. 1313 would punish employees who refuse to turn over ADA or GINA protected information, including their family's genetic information, as part of an employer-sponsored program that promotes healthy habits. Now, H.R. 1313 uses euphemisms like incentives, rewards, rebates, and inducements to mask what is essentially coercion to turn over information protected by civil rights laws. It's a sad fact that employment discrimination is real. Even 55 years after the creation of the EEOC, the data is clear. In fiscal year 2016 alone, there were 91,000 discrimination charges filed with the EEOC, of which 30% were based on disability. H.R. 1313 is introduced, undermines the safe harbor provision found in Title IV of the ADA, which permits insurers or entities administering a benefit plan from establishing, sponsoring, or observing or administering the terms of a bona fide benefit plan that are based on underwriting risk, classification risk, or administering such risks that are based on or not inconsistent with state law. Simply put, the ADA law already permits insurance companies to assist and classify risks that are driven by data. What H.R. 1313 attempts to do is far from providing a safe harbor. This language is overly broad and dangerous. The language would exempt wellness plans from the ADA, rendering the reasonable accommodation or retaliation protections unenforceable. With such a presumption, this legislation undermines the EEOC's effective enforcement of the ADA and GINA, particularly relating to assessing whether a wellness program is discriminatory. Madam Chair, H.R. 1313 would permit the collection of genetic information of family members as part of the workplace wellness program, despite the fact that Title I and Title II of GINA expressly protects the information from being required of individuals. Now, I respectfully reject the characterization of the disclosure of genetic information of family members as incentives, rewards, rebates, or inducements. Simply put, the collection of this data is a violation of GINA's civil rights and privacy protections. In addition, H.R. 1313 opens the door to an employee facing a crippling 50% penalty if that employee chooses not to disclose their ADA or genetic protected information. Finally, H.R. 1313 does nothing to protect an employee from being subsequently fired or discriminated against if an employer were to use ADA or genetic information received under the wellness program. That could be a very profitable thing to do if the employee is predicted to incur certain illnesses, which could be very expensive if the employer is self-insured, or if you're on a basically an experience-based insurance plan. It could be very expensive to have a employee incurring a very difficult illness. And so if you're fired or discriminated against, there would be reason for the employer to do it. Madam Chair, the wellness programs can be run without forcing employees to disclose sensitive health care or genetic information that the employee doesn't want to disclose. This bill allows the employer to require that information, whether or not the employee wants to disclose that information, and the penalty could be a very substantial and probably unaffordable financial penalty. I would hope that we would not adopt the bill as it is. These programs can go forward. They're very valuable, but you shouldn't have to give up your civil rights to participate. Madam Chair, I yield back.
Thank you, Mr. Scott. Mr. Thompson, you're recognized.
Thank you, Madam Chair. I guess I have a less, or a perspective on the underlying bill, a very positive one, that's less from a conspiratorial perspective. When I was 11 years old and a tenderfoot Boy Scout, I learned that the best first aid was prevention. And I think the best health care, and as a health care professional that practiced for nearly 30 years before coming to Congress, I learned the best health care is prevention. And I also saw the onset as we had managed care plans roll out of insurance companies that had bought into wellness programs, only to find that it didn't get sustained because of how fluid people were with choosing their coverage. Every year when they had the opportunity, they many times moved between. So I'm very excited about this underlying piece of legislation, H.R. 1313, because this strengthens the position of the employer, which is the continuity to be able to provide access to wellness programs. And these wellness programs are some of the best health care. It's certainly the most affordable. It's the most less stress on if you can keep people well, it has such a benefit. And this underlying piece of legislation just clarifies that if a wellness program is offered in conjunction with an employer-based health plan, that it complies with the wellness provisions in HIPAA. And I've never met anyone that thought HIPAA was kind of a easy and soft regulation to comply with. But it also goes beyond that. The program will be considered in compliance with the voluntariness requirements of both the ADA and GINA. So I just, I want to thank the authors of this bill, and I certainly encourage the support of H.R. 1313. Thank you, Chairwoman.
Thank you, Mr. Thompson. Mr. Grijalva.
Thank you, Madam Chair. I don't have an amendment because I can almost guarantee you would have been ruled that it was not germane. But, frankly, I think that while we're dealing with these three pieces of legislation, that we've missed an opportunity to make this discussion about healthcare much broader, as we did almost 8 years ago, when this 7 years ago, when this committee in earnest participated in the development of the Affordable Care Act. And while these bills are important, they're a distraction, I think, to some extent from what's going on in the other two committees of substance, what's going to happen with the American Health Care Act
that was filed, Trump Care, or Ryan Care, whichever you want to call it. And it's been close now, 7 years, over 7 years, since the ACA became law. Despite the unanimous opposition by my Republican colleagues to it, and the endless bluster and attempts to repeal the law by Republicans in the House of Representatives, ACA has produced a historic shift in health policy, a step toward universality, and dramatically lowering the number of uninsured people in this country. And I think for that, to improve on that, I think should be the task before us, not to undo that kind of shift and that kind of movement in accessibility and affordability of healthcare in this country. I don't understand why we are having any discussions of healthcare without a CBO score. A report that would shed nonpartisan light on the American Health Care Act, about what the real costs are going to be, about accessibility, about affordability, about job loss, the levels of coverage. I think it's important. That can give this committee or any committee member of Congress the opportunity to truly know if this repeal process and the replacement that's being talked about really has any substance. Underlining this whole discussion about Trump Care is the budget and how to pay for the tax breaks and cuts for the very wealthy that are sure to be part of that. You know, what's at stake, I think, is important also to reflect on. The Affordable Care Act had some very strong efforts to begin to close health disparities in this country between peoples. And now that's derailed or lost. Indian health care was a huge component of what was being delivered with the Affordable Care Act. And although the language is sustained in the present Trump Care proposal that's before us, it's hollow. There is no revenue to be generated anymore, and if all subsidies and fees and taxes are removed, then it's a hollow statement. The most underserved, underrepresented group of Americans, Native Americans, who have the worst indices in healthcare, again, get a nice statement, but don't get the revenue or the funding to make a real dent. We're looking at the rationing of healthcare in this country. We're looking at less coverage and higher cost. We're looking at an age tax for people 50 years or older. And millions of insured people will not be insured with the elimination of the individual subsidies. We're ending Medicaid as we know it in 2020, and a per capita cap system leading in what I believe will be deep cuts in Medicare. New restrictions on women's right to comprehensive health care and gender-based cost, the discrimination behind that toward women returning again. Now, I can say that because we have a replacement that has no substance to it, that people are marking up today. Without a CBO score, we are whistling past the graveyard because we are not dealing with reality and we are not dealing with consequences. I believe this committee had a stronger calling to be involved in the very discussions that are going on in two committees. I think we missed an opportunity, Madam Chair, and with that, I yield back.
Thank you, Mr. Grijalva. Mr. Courtney, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. The clerk has an amendment at the desk.
Mr. Courtney, is there anyone else seeking
Oh, I'm sorry. I thought.
to speak on this substitute?
Do you want me to yield back and then you can take us to the next step? Is that
Mr. Courtney, my understanding was that I would recognize Ms. Adams
Okay,
first and then come to you.
very good? I'll yield back.
Ms. Adams, do you seek recognition?
Yes, Madam Chair, I do.
For what purpose?
I have an amendment.
The clerk will distribute the amendment.
Madam Chairwoman.
Mr. Thompson, you're recognized.
Madam Chairwoman, I reserve a point of order on the amendment.
The point of order is reserved. The gentlewoman from North Carolina, Ms. Adams, is recognized for 5 minutes to explain her amendment.
Thank you, Madam Chair. Ranking Member Scott, for consideration of my amendment, which encourages Congress to preserve health care for millions of Americans by keeping costs low, keeping the number of uninsured low, and providing quality plans that are affordable. The Preserving Employees Wellness Program Act is another attempt by ACA critics to undermine our nation's health care system. Under this bill, wellness programs would enjoy nearly unregulated ability to circumvent civil rights in order to shift health care costs to workers. Wellness programs would violate neither the Americans with Disabilities Act nor the Genetic Information Non-Discrimination Act if they impose up to 30% of the family premium as a penalty for keeping medical information private. Further, the Equal Employment Opportunity Commission's interpretation of GINA to forbid penalties for choosing not to disclose one's children's health information would be reversed. In essence, this would allow companies to penalize consumers for not disclosing private information regarding their health history. Not only is this neglect, but it's a stark rollback of civil rights and consumer protections, particularly for those with disabilities. Further, through penalties, this bill increases costs for patients. Although this bill has a long way to go before it's sufficient, my amendment is a sense of Congress advocating that any health care reform package should include more affordability as measured by the amount that individuals pay out of pocket toward insurance, only be considered with the CBO score that certifies that health care is less costly as measured by the average premium for comparable benefits, better quality plans as measured by improved benefits, and a guarantee that any new plan does not increase the number of uninsured. Health care in this country, Madam Chair, should be a right for everyone, not a privilege for a few. So I urge my colleagues to support those who need, have, and want their health coverage preserved. Thank you, Madam Chair, and I yield back.
Thank you, Ms. Adams. Anyone else who wishes to speak on the amendment? Ms. Adams, you are recognized again on your amendment.
Thank you, Madam Chair. I just want to encourage the committee to keep in mind all of our constituents and the impact of the decisions that we'll make through this bill, and I withdraw my amendment.
Thank you very much. Mr. Espaillat, I understand you would like to be recognized.
Thank you, Madam Chair. I have an amendment at the desk.
The clerk will distribute the amendment. Mr. Thompson, you're recognized.
Thank you, Madam Chairwoman. I reserve a point of order on the amendment.
The point of order is reserved. The gentleman from New York is recognized for 5 minutes to explain his amendment.
Yes, I have an amendment at the desk that provides a common sense change that ensures individuals who participate in employee wellness programs are doing so voluntarily and without fear that their private health information will be used against them by their employers. I hope that my colleagues will side with protecting our country's workers and support this amendment. I don't think that anyone would argue that having a healthy workforce or ensuring that healthy work environments exist are bad initiatives. However, if the end goal of wellness program is to promote health and well-being, we must ensure that all workers, including those who do not want to disclose sensitive and private health information, can access them. H.R. 1313, the Preserving Employee Wellness Programs Act, however, allows critical anti-discrimination laws like the Americans with Disabilities Act and the Genetic Information Non-Discrimination Act to be circumvented in employer-provided wellness plan. Both the ADA and the Genetic Non-Discrimination Act contain general prohibitions against the non-voluntary collection of certain medical information from employees without justification, and H.R. 1313 seeks to undermine these protections. By heavily incentivizing employees to divulge sensitive health information, there is concern that those employees will feel forced to disclose private health information when they are actually not comfortable doing so. For example, Employers who are in fact unhealthy or struggling with a disease that is not readily apparent may feel forced to disclose this information because of the potential financial penalties permitted by H.R. 1313. Not only do the possibilities of financial burdens for employees who fail to release this information exist, but the fear of potential discrimination based on an employee's disclosure of personal and private health information is also very real. Employers should not have to choose between disclosing personal health information in order to avoid financial penalties and not disclosing such information for fear that they will be discriminated against based on that very information. This amendment addresses the employment discrimination concerns that could become a reality as a result of the Preserving Employee Wellness Programs Act. Specifically, it would prohibit the use of any information obtained by an employer as part of any workplace wellness program or program of health promotion or disease prevention with regards to employment decisions. It would further prevent the transfer of any information obtained to another entity. If an employee discloses that he or she struggles with an illness like bipolar disorder or depression, we must ensure that they are protected from that information being used against them when they are being considered for a promotion or a raise. And certainly, we must ensure that the information cannot be used as a reason for or means of discharging that individual. Again, I am presenting this common sense amendment that ensures individuals who participate in employee wellness programs are doing so voluntarily and without fear that their private health information will be used against them by their employers. I yield the remaining part of my time.
I thank the gentleman from New York, and I recognize Mr. Thompson from Pennsylvania.
Thank you, Madam Chair. And I do thank my friend from New York for raising this issue. I think absolutely everyone on this committee, Republicans and Democrats, oppose discrimination in the workplace. And all workers deserve to be treated fairly, equally, and judged solely on their hard work and merit. That's why there's been long-standing strong bipartisan support for federal policies that outlaw employment discrimination. And if these policies are reflected in important laws, such as the Civil Rights Act, the Americans with Disabilities Act, the Equal Pay Act, and the Age Discrimination in Employment Act, and others. And all these laws remain in force today, and nothing in this legislation will change that. Workers who choose to participate in employee wellness programs will continue to receive the robust protections provided by our nation's anti-discrimination laws. There is no need to reaffirm anti-discrimination policies in this context under President Obama's Affordable Care Act, and there's simply no reason to do so today. Now, by accepting this amendment, we would be inviting greater legal uncertainty and confusion where there is no confusion, where the law of the land stands against discrimination in the workplace. And as a result, fewer workers would be able to enjoy the benefits of participating in employee wellness programs, which I just personally believe, and I've seen in my past professional life, provide just tremendous health benefits. For these reasons, I urge my colleagues to vote no on the amendment and yes on the underlying bill. And I yield back.
Thank you, Mr. Thompson. Mr. Scott, do you seek recognition?
Move to strike the last word.
Mr. Scott, you're recognized for 5 minutes.
Thank you. Madam Chair, just very briefly, I just want to emphasize that this amendment is extremely important because it just says that the information that you're coerced into giving up cannot be used to discriminate against you or transferred to another entity for any purpose. If you're forced to disclose this, it just says you can't discriminate. Now, there could be a lot of information, particularly genetic markers, that may indicate an increased risk of cancer. You can't unring the bell. The employer knows this. And if he uses that information to discriminate against you in the future in terms of raises, in terms of firing you, that ought to be illegal. And that's all this amendment does, and I hope we would support it.
Thank you, Mr. Scott. Any member seek recognition? Yeah. Case. If none, the question occurs on the amendment. All those in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the noes have it, and the gentleman's amendment is not agreed to.
I ask for a recorded vote, Madam Chair.
The gentleman requests a recorded vote pursuant to Rule 13B of the committee and House Rule 11-2H, and as is the committee's practice, further proceedings on this amendment shall be postponed. Are there any other members seeking recognition?
Madam Chairman.
Mr. Courtney, you're recognized.
Thank you, Madam Chairwoman. The clerk has an amendment at the desk.
The clerk will distribute. Mr. Thompson, you're recognized.
Thank you, Madam Chairwoman. I reserve a point of order on the amendment.
The point of order is reserved. The gentleman, Mr. Courtney, is recognized for 5 minutes.
Thank you, Madam Chairwoman. And again, at the outset, I would just say, again, as a former employer, wellness programs are good. Wellness programs are alive and well, and it's actually an industry which actually does quite well in terms of selling its product, and that's a good thing. The bill before us does move the needle in terms of what I think the ranking member very powerfully stated, which is that it really creates a coercive sort of structure to basically force people to sacrifice privacy rights and non-discrimination rights that existing law presently allows, and which, by the way, our committee created. The Genetic Information Non-Discrimination Act was, again, another proud legacy of the Education and Workforce Committee a number of years ago. So my amendment actually is a very simple one-sentence amendment, and it clarifies a point that came out during the committee deliberations. Kudos to the chairwoman for holding a real process on this bill. And it basically says that no information obtained as part of a wellness program can be sold or otherwise transferred to any other entity for any purpose. And again, this is not a paranoid conspiracy sort of notion, which was sort of alluded to earlier. The fact of the matter is that the data collection that goes into wellness programs in many instances is either it can be collected by an employer or it can actually be collected by a third-party vendor. And as I said, that's actually a pretty sort of healthy cottage industry in the country. Those vendors, because they're not health insurance carriers or medical providers, are not covered by HIPAA. And they, again, have no obligation to the employee in terms of protecting the privacy of that information. The Harvard Business Review in January actually did a very lengthy analysis of this, the title of which is Workplace Wellness Programs Could Be Putting Your Health Data at Risk. And it basically goes on to say often employees are not informed before joining a wellness program that vendors may sell the health information that they collect. In fact, this does not appear to be well known among employers either. And again, because they are for-profit entities and not connected to any health insurance carrier, that means much of the information that their programs collect exists in a legal gray area and is not protected by HIPAA. And is also, again, this law does nothing to improve that situation. So my amendment just simply says, if the purpose of that data collection is to create wellness programs that are going to be, good for the health plans and good for the workplace, which again is an arguable point, as the ranking member indicated. At least we should clarify that people should not be turning around and selling this data, which is, again, what the Harvard Business Review has told us is in fact happening out there, because the HIPAA law does not extend to these vendors who are collecting that information. Again, I can't imagine any opposition to this notion that, if the mission of data collection is to promote wellness programs, it should stop there. It should not be, again, used for another purpose, which is to actually gain profit from that information, which again now extends to the children of employees because of the amendment which was offered at the outset of this process. So, Madam Chairwoman, number one, I want to submit for the record, because I want to crystal clear before any vote is taken, that there is a very solid documentation by the Harvard Business Review of the fact that vendors are selling this information, and we need to put a stop to it. And my amendment will accomplish that point and would not interfere really with the underlying bill's goals, which again, there's another debate that we could have about that. But clearly, the folks who are collecting this information should not be able to turn around and sell it without the knowledge of the people, the employees who, again, are being somewhat coerced in terms of disclosing whether it's genetic information, pre-existing conditions, disabilities, which again are really, I think, the core of what every American believes should be private information and not sold out there to the highest bidder. And with that, I would yield. And again, I would ask that this Harvard Business article be admitted.
Without objection.
Thank you. I yield back.
Thank you, Mr. Courtney.
Madam Chair.
Mr. Byrne, you're recognized.
Thank you, Madam Chair. And I appreciate my colleague from Connecticut and his strong advocacy for privacy rights. I think that all of us on this committee are concerned and care deeply about the privacy rights of the citizens of the United States of America. That is why this bill requires every employer to comply with HIPAA. Even under this bill, every employer will have to comply with HIPAA. We don't exempt anybody who's covered by this bill from complying with HIPAA. Now, we've talked about privacy before on this committee. I remember we had some conversations the last couple of years about trying to protect employees' privacy when unions were trying to get their private personal information. And unfortunately, because of opposition from the other side of the aisle, we weren't successful in being able to do that. So there's certain information that the National Labor Relations Board is allowing unions to get that is personal, private information of people who don't want those unions to have it. I wish we had had that same spirit during that legislation that we're hearing now. If I thought for 1 second that this was going to in any way violate HIPAA, I would be opposed to it because I think it's extraordinarily important that we do this. What is important here is that we have consistency across our laws for employers that have these wellness programs. HIPAA put out a regulation. The health care law said that's compliant with the health care law. And then sort of at the last minute, after everybody knew what the law was or thought they knew what the law was, the EEOC comes forward and says, wait a minute, we got a new standard, which is contradictory of the HIPAA standard. Now put yourself in the place of a small to medium-sized business. How do you comply with that? It's a nightmare for them to comply with that if they even can. Some of the testimony we heard last week from the panel we had was that not only is what the EEOC interpretation done in conflict with HIPAA, you've actually got Gina in conflict with the ADA. So pity the poor person out there that's trying to comply with all this when it's all conflicting with one another. What we're trying to do in this bill is make sure we have one consistent standard, and that standard is the HIPAA standard. And by keeping with the HIPAA standard, we protect every employee and every workplace in America. So I appreciate my colleague's strong feelings about this. I share his strong feelings about it. I don't want employees' personal information getting out there either. But I think we have given very good protection here by requiring the continued compliance with HIPAA, and I would say that his concerns are misplaced in the context of this particular bill, and I yield back the balance of my time.
Gentleman yields back.
Chair.
Mr. Scott, you're recognized.
Move to strike the last word on the amendment.
The gentleman is recognized for 5 minutes.
Thank you, Madam Chair. I yield to the gentleman from Connecticut.
Gentleman from Connecticut is recognized.
Thank you. Thank you, Mr. Scott, and thank you, Madam Chairwoman. And just very briefly, again, I have the highest regard for Mr. Byrne, and it seems like we've been doing this a little bit lately in terms of having some good, healthy dialogue on different issues. But the point that I think the Harvard Business Review made is that, yes, HIPAA exists, and insurance carriers are regulated by it, and doctors and hospitals and healthcare providers are regulated by it. The problem is with the existing system of wellness programs is they're not the ones collecting the data. It is third-party vendors. It's not even the employer who's collecting the data, and they're not covered by HIPAA. And that's really what the report that I submitted for the record made very clear, and that's why, we're seeing is these organizations are free to do with that information whatever they like, and it's being done in many instances even without the knowledge of their clients, the employers who are hiring them in good faith to collect this data. So my amendment, again, is very clear. It's not just restricting employers from using data or selling data. It really just makes it a blanket prohibition so that non-HIPAA regulated entities are not allowed to turn around and sell people's health information. And I appreciate the point he made regarding the NLRB rule, but I would just point out that we're talking about something a lot different here. The NLRB rule was about data or information about where you can call somebody and what their address was in an organizing drive. What we're talking about here, again, is somebody's health records and their kids' health records. And to me, that just is in a far different level in terms of seriousness, and people should not be able to use that information to turn around and sell it. And that's what this amendment seeks to stop, and I yield back.
Gentleman from Virginia yields back. Are there any other members seeking recognition? If none, the question occurs on the amendment. All those in favor say aye. Aye. All those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to. The gentleman requests a recorded vote pursuant to Rule 13B of the committee and House Rule 11-2H, and as is the committee's practice, further proceedings on this amendment shall be postponed. Mr. Polis?
I have an amendment at the desk. Amendment number 4.
The clerk will distribute the amendment, and Mr. Thompson, you're recognized.
Madam Chairwoman, I reserve a point of order on the amendment.
The point of order is reserved.
And if you could ask Mr. Polis to, again, let us know which amendment he wants to distribute.
If the gentleman from Colorado would tell us which amendment, you have two amendments.
Amendment 4, permission to sell.
Thank you very much. The gentleman is recognized for 5 minutes to explain his amendment.
Thank you, Madam Chair. This amendment is very simple. It would improve the bill by requiring that permission must be granted from the individual before your private information that's obtained in a wellness program can be sold. I think it's very important that we uphold the principle that your boss or an insurance company shouldn't be able to sell data about you without your permission. Not just any data, it's actually some of the most personal data, like whether you or how you want to start a family, whether you plan to get pregnant, any medical condition that has no impact on the job. But you know that if the information goes to your boss, it could be sold without the inclusion of this amendment in the bill. That's the kind of information that could destroy friendships, careers, even relationships. As soon as any of the information is sold, every corporation or company out there would then have the opportunity to send you harassing phone calls, mailers, and emails, further damaging your privacy. As Americans, we have a right to our privacy, and if our colleagues share my belief in the Constitution, we should vote yes on this amendment. Shouldn't employees at least have to give permission before their most personal health care secrets are simply sold to the highest bidder, along with their contact information? If this bill is about protecting the health and well-being of Americans and improving wellness programs, we need to make sure that we protect privacy along the way. My amendment, very simply, will protect the privacy of Americans, whether they want to partake in a wellness program or not, and uphold all of our constitutional rights. I encourage my colleagues to support my amendment, and I yield back the balance of my time.
Thank you very much, Mr. Polis. Does anyone seek recognition to speak on the amendment? If none, the question occurs on the amendment. All those in favor say aye. Aye. All those opposed say no. No. In the opinion of the chair, the noes have it, and the gentleman's amendment is not agreed to.
Madam Chair, I request a recorded vote.
The gentleman requests a recorded vote pursuant to Rule 13B of the committee and House Rule 11-2H, and as is the committee's practice, further proceedings on this amendment shall be postponed.
Madam Chair, I have an amendment at the desk, amendment number 5.
The clerk will distribute the amendment. Mr. Byrne, you recognize.
Madam Chairwoman, I reserve a point of order on the amendment.
The point of order is reserved. The gentleman from Colorado is recognized for 5 minutes to explain his amendment.
Madam Chair, this amendment is also privacy related. It's very important. And although the legislation we're considering is supposed to be about improving wellness programs, it really, without this amendment, would destroy an intricate part of the very foundation of American culture in our country, and that's our privacy and our right to privacy. We all want to develop better wellness programs, encourage healthy eating and regular exercise, of course. Under the guise of that, however, we want to make sure that we don't mask the intent of unscrupulous employers who could use these incentives to force employees to answer very intrusive questions about their and their families' health, or their sex lives, or their sleeping patterns, and even genetic tests that they and their family have undergone. This is private information. It's none of your boss's business. It's none of the government's business. This amendment would strike language in the bill that would erode the protections of genetic information for employees and their families. The Genetic Information Non-Discrimination Act, or GINA, was actually enacted in 2008 to ensure that the public would be free from genetic discrimination by health insurance providers and employers. GINA is important because it protects information about an individual's genetic tests and the tests of your family members, and information about disorders and conditions that individuals and their family members have. GINA prohibits employers from asking employees about the medical condition of their family members, and it does provide an exception. That is, when an employer offers health or genetic services as part of their wellness program. The key part of that exception is it's voluntary. This legislation in its current form would undercut that, would undermine the privacy and voluntary provisions of the Genetic Information Non-Discrimination Act, opening the door to a Gattaca-like future for our country. The bill would allow employers to impose stiff and unreasonable financial penalties, up to 50% of insurance premiums, if employees refuse to reveal their genetic code or their family members' genetic code. Can you imagine having to prove genetic information to an employer? The embarrassment or the stigma that comes along with showing perhaps that your mother might have bipolar disorder, or your sister is anorexic, or your son or daughter suffers from depression. On top of that painful invasion of your privacy, your employer may find a way to fire or not promote you simply because you're concerned that you might get multiple sclerosis someday. Frankly, it makes me sick thinking about the position that this bill would put Americans in by allowing Americans to be taken advantage of and giving this huge power of the government and employers over their employees. We really need to pass this amendment because we care about our constituents' privacy as well as their physical and emotional health. We want to have a bright future for our country, not one in which the government and employers classify their employees based on their genetic code. I ask you to support my amendment, and I yield back the balance of my time.
Thank you, Mr. Polis. Mr. Byrne, do you seek recognition?
I do, Madam Chairman. I'd speak to the amendment.
You're recognized for 5 minutes.
It's very important for many families that have opportunities to participate in this wellness program that they participate as a family. Sometimes it's not just mom or dad or mom and dad. You also have the children of the family that want to participate as well. And that's a good thing. It's a good thing for the families. It's a good thing for the employers. What the EEOC has done has made it more difficult for families to participate. I'm not saying that was their intent, but that's the effect of what they've done. And here's the key here. No information can be compelled from a minor without the parent's consent under this legislation. If the parent says no, then no information goes from the minor to anybody else. And that is America. We let parents control what their children do and don't do when information from their children goes to another adult. As a parent with 4 grown children, now a grandparent, I'm comforted by that. There are some instances where I worry that the federal government wants to restrict my ability to include my children and now my grandchildren in certain things. This gives parents the freedom to choose whether they want to participate with their children in these wellness programs, and allows the parents to have the freedom to choose about what, if any, information they're going to provide to it. As far as I'm concerned, so long as mom and dad have the right to say no, That's enough for me, because I think mom and dad will make a much better decision than a bunch of unelected bureaucrats in Washington. And I yield back.
Mr. Chair.
The gentleman yields back.
Madam Chair.
Mr. Scott, you're recognized.
Move to strike the last word.
The gentleman's recognized for 5 minutes.
Madam Chair, the problem with this situation is that although it's a parent's choice, with the financial penalty as large as it is, the parent is essentially coerced to give up the information, and that's what we're trying to protect. I will yield back.
Thank you. Mr. Grijalva, you're recognized.
Thank you, Madam Chair. I'd like to yield to Mr. Polis.
Thank you, Madam Chair. I want to address again Mr. Burns' comments. It is already the rule that there's an exception from the Genetic Information Non-Discrimination Act when the employee's participation is voluntary. This bill undermines that because it allows for a stiff financial penalty, increasing the cost of insurance by 50%. So effectively, it is forcing people who don't have any alternatives because of their budget into divulging their minor's genetic code. Again, the gentleman said that they only disclose their kids under 18 genetic code on a voluntary basis. However, what you don't mention is there's a stick attached to that. The parents could be charged 50% more on their insurance premium if they refuse to reveal the private genetic code of their own children. We all want families to be healthier, that we shouldn't have to sacrifice our privacy to be able to do that. People who want to participate in these programs should be able to. If there's savings that can be accrued, that's wonderful, but penalties are not what we should be using. We should be using the carrot rather than the stick. This bill uses the stick. I think we could have a broad bipartisan consensus that we ought to encourage the carrot to be used to encourage healthy families, but never at the force of a 50% penalty effectively require parents to divulge the genetic codes of their children to their bosses and to the government. And I yield back, and I thank the gentleman from Arizona.
The gentleman from Arizona yields back. Are there any other members seeking recognition? If none, the question occurs on the amendment. All those in favor say aye.
Aye.
All those opposed, no. In the opinion of the chair, the noes have it, and the gentleman's agreement.
Madam Chair, I request a recorded vote.
The gentleman requests a recorded vote pursuant to Rule 13B of the committee and House Rule 11-2H, and as is the committee's practice, further proceedings on this amendment shall be postponed. Mr. Scott, you're recognized.
Madam
for
Chair, I
5 minutes.
have an amendment at the desk.
The clerk will distribute the amendment, and Mr. Byrne, you're recognized.
Madam Chairwoman, I reserve a point of order on the amendment.
A point of order is reserved. The gentleman from Virginia is recognized for 5 minutes to explain his amendment.
Thank you, Madam Chair. This amendment would ensure that wellness programs are not considered, quote, a bona fide benefit plan under the safe harbor provision of the Americans with Disabilities Act. Madam Chair, the safe harbor provision was included in Title IV of the ADA to permit insurers or entities to administer benefit plans that establish, sponsor, observe, or administer the terms of a bona fide benefit plan that are based on underwriting risks, classifying risk, or administering such risks that are based on or not inconsistent with state law. In other words, a safe harbor position in the ADA was included to permit insurers to develop risk models that relied on data and actuarial models, and therefore they could treat some employees differently than others. I would add at the time the safe harbor was included in the ADA, insurers were permitted to discriminate against persons with pre-existing conditions, a practice now prohibited by the Affordable Care Act. But the 1990 House Education and Workforce Committee report made it clear that a person with a disability cannot be denied insurance or subject to different terms of conditions of insurance just based on disability alone if the disability does not impose increased risks. And what stands out in the House and Senate committee reports is Congress's clear intent regarding the safe harbor provisions of the ADA. The House report states that the ADA requires that underwriting and classification of risk be based on sound actuarial principles or be related to actual or reasonably anticipated experience. The Senate report affirmed that the committee does not intend that any provision of this legislation would affect the way insurance industry does its business under state laws. So what emerges from the examination of the ADA's legislative history is that safe harbor provision specifically applies to those who underwrite, classify, or administer risk. Madam Chair, wellness programs are not insurance plans that rely on underwriting, classifying, or administering risk. They are plans to encourage people to eat healthy, exercise, sleep more, and so H.R. 1313 requires an answer to the question, why would an employer need sensitive information about employees' disability to promote participation in wellness plans? Why does the wellness plan need wholesale exemptions from the ADA? After all, when an individual shares with an insurance, what an individual shares with an insurance company is expected to be private and only considered part of a risk assessment for insurance purposes. And that information is protected by HIPAA. So what an employee discusses with her employer about his disability is supposed to be voluntary and only in the context of addressing reasonable accommodations in the workplace. But what H.R. 1313 does is far from providing a safe harbor. This language is overbroad and dangerous. The language would open the door for unscrupulous employers to misuse the sensitive information in a manner that skirts ADA's reasonable accommodation or retaliation protections. And therefore, I ask for a yes vote on this amendment. Yield back.
The gentleman yields back. Mr. Byrne, do you seek recognition?
I do.
The gentleman's recognized for 5 minutes.
The Americans with Disability Act provides employers a safe harbor in order to administer their bona fide health benefit plans. Now, the 11th Circuit Court of Appeals has held that wellness programs can be a part of a bona fide benefit plan, and that falls within the ADA safe harbor. Contrary to the plain language of the law and the Circuit Court's decision, the EEOC has taken the position that wellness programs, even if offered as part of an employer-sponsored health plan, do not receive the safe harbor protections. This amendment would actually change the Americans with Disability Act by excluding wellness plans offered as a part of an employer-sponsored health plan based on underwriting risks from the safe harbor. To be clear, a wellness plan is part of an employer-sponsored benefit plan, which still have to be designed to minimize underwriting risks in order to qualify for the ADA safe harbor. The ADA safe harbor is a well-considered provision that gives employers flexibility in designing benefit plans, and this amendment would undermine that statutory provision. Just as importantly, this amendment would create even greater legal uncertainty and confusion, denying working families access to responsible wellness programs that have been shown to promote a healthier workforce and reduce health care costs. So I urge my colleagues to vote no on the amendment. I yield back.
The gentleman yields back. Are there any other members seeking recognition? If none, the question occurs on the amendment. All those in favor say aye.
Aye.
All those opposed say no. No. In the opinion of the chair, the noes have it, and the gentleman's amendment is not agreed to. The gentleman requests a recorded vote pursuant to Rule 13B of the committee and House Rule 11-2H, and as is the committee's practice, further proceedings on this amendment shall be postponed. Are there any other members seeking recognition? If none, and having completed debate on amendments, we shall proceed to requested recorded votes. The question occurs on the amendment offered by Representative Espaillat.
Parliamentary inquiry. What bill are we now considering?
Thank you, Mr. Scott. We are on H.R. 1313.
Okay.
Thank you for asking clarification. The question occurs on the amendment offered by Representative Espaillat. All those in favor say aye.
Aye.
All those opposed say no. No. The clerk will call the vote. Roll.
Mrs. Fox?
No.
Mrs. Fox votes no. Mr. Wilson?
No.
Mr. Wilson votes no. Mr. Hunter? Mr. Hunter votes no. Mr. Rowe? Mr. Rowe votes no. Mr. Thompson? Mr. Wahlberg? Mr. Wahlberg votes no. Mr. Guthrie? Mr. Guthrie votes no. Mr. Rokita? Mr. Barletta? Mr. Messer? Mr. Byrne? Mr. Byrne votes no. Mr. Bratt? Mr. Grothman? Mr. Russell? Mr. Russell votes no. Ms. Stefanik? Mr. Allen? Mr. Lewis? Mr. Lewis votes no. Mr. Rooney? Mr. Rooney votes no. Mr. Mitchell? Mr. Mitchell votes no. Mr. Garrett? Mr. Garrett votes no. Mr. Smucker? Mr. Smucker votes no. Mr. Ferguson? Mr. Scott? Mr. Scott votes aye. Mrs. Davis? Mrs. Davis votes aye. Mr. Grijalva? Mr. Grijalva votes aye. Mr. Courtney? Mr. Courtney votes aye. Ms. Fudge? Ms. Fudge votes aye. Mr. Polis? Mr. Polis votes aye. Mr. Sablon? Mr. Sablon votes aye. Ms. Wilson? Ms. Bonamici? Ms. Bonamici votes aye. Mr. Takano? Mr. Takano votes aye. Ms. Adams? Ms. Adams votes aye. Mr. DeSaulnier? Mr. DeSaulnier votes aye. Mr. Norcross? Mr. Norcross votes aye. Ms. Blunt Rochester? Ms. Blunt Rochester votes aye. Mr. Krishnamurthy? Mr. Krishnamurthy votes aye. Ms. Shea Porter? Ms. Shea Porter votes aye. Mr. Espilot? Mr. Espilot votes aye.
The clerk will request a vote from those who were passed over in the first time. We'll start with Mr. Wilson.
Mr. Wilson? Mr. Wilson is recorded as a no. Mr. Thompson?
Sorry.
Mr. Rokita? Mr. Rokita is not recorded. Mr. Rokita votes no. Mr. Barletta? Mr. Barletta votes no. Mr. Messer? Mr. Bratt? Mr. Grothman? Mr. Grothman votes no. Ms. Stefanik? Ms. Stefanik votes no. Mr. Allen? Ms. Wilson? Ms. Wilson votes aye. Mr. Ferguson? Mr. Ferguson votes no.
How is Mr. Bratt recorded?
Mr. Bratt votes no.
How is Mr. Messer recorded?
Mr. Messer votes no.
How is Mr. Allen recorded?
It's not recorded. Mr. Allen votes no.
Are there any members who have not recorded their votes? The clerk will report the totals.
Madam Chairman, the ayes are 17 and the nays are 21. Oops, sorry. Madam Chairman, the ayes are 21 and the nays are 17. Sorry, wait.
Let's try that again.
Again.
Clerk knows what she's doing.
21 ayes. Madam Chair, the ayes are 21 and the nays are 17.
Okay. Madam Chair?
Sorry, this is all messed up here. Excuse me. I know.
Sorry.
Okay. 17. Madam Chairman,
The clerk will report the totals.
the yeas are 17 and the nays are 21.
Thank you, Madam Clerk. We're now going to vote on. Oh, the amendment is not agreed to. We will now take our second vote on amendment number 3, offered by Mr. Courtney to prohibit information obtained in a wellness program from being sold. This is on H.R. 1313. The clerk will call the roll.
Mrs. Fox?
No.
Mrs. Fox votes no. Mr. Wilson? Mr. Wilson votes no. Mr. Hunter? Mr. Hunter votes no. Mr. Rowe? Mr. Rowe votes no. Mr. Thompson? Mr. Wahlberg? Mr. Wahlberg votes no. Mr. Guthrie? Mr. Guthrie votes no. Mr. Rokita? Mr. Rokita votes no. Mr. Barletta? Mr. Messer? Mr. Messer votes no. Mr. Byrne? Mr. Byrne votes no. Mr. Bratt? Mr. Bratt votes no. Mr. Grothman? Mr. Grothman votes no. Mr. Russell? Mr. Russell votes no. Ms. Stefanik? Mr. Allen? Mr. Allen votes no. Mr. Lewis? Mr. Lewis votes no. Mr. Rooney? Mr. Rooney votes no. Mr. Mitchell? Mr. Mitchell votes no. Mr. Garrett? Mr. Garrett votes no. Mr. Smucker? Mr. Smucker votes no. Mr. Ferguson? Mr. Ferguson votes no. Mr. Scott? Mr. Scott votes aye. Mrs. Davis? Mrs. Davis votes aye. Mr. Grijalva? Mr. Grijalva votes aye. Mr. Courtney? Mr. Courtney votes aye. Ms. Fudge? Ms. Fudge votes aye. Mr. Polis? Mr. Polis votes aye. Mr. Sablan? Mr. Sablan votes aye. Ms. Wilson? Ms. Wilson votes aye. Ms. Bonamici? Ms. Bonamici votes aye. Mr. Takano? Mr. Takano votes aye. Ms. Adams? Ms. Adams votes aye. Mr. DeSaulnier? Mr. DeSaulnier votes aye. Mr. Norcross? Mr. Norcross votes aye. Ms. Blunt Rochester? Ms. Blunt Rochester votes aye. Mr. Krishnamurthy? Mr. Krishnamurthy votes aye. Ms. Shea Porter? Ms. Shea Porter votes aye. Mr. Esplat? Mr. Esplat votes aye.
How is Ms. Stefanik recorded?
Ms. Stefanik is not recorded.
How is Mr. Barletta recorded?
Ms. Stefanik votes no. Mr. Barletta is not recorded. Mr. Barletta votes no.
Madam Chairman,
How is Mr. Thompson recorded?
Mr. Thompson is not recorded.
no.
Mr. Thompson votes no.
Are there other members who are not recorded, who wish to be recorded? The clerk will report the vote.
Madam Chair, there are 17 ayes and 22 nays.
The amendment is not agreed to. The next vote is vote number 3 on amendment number 4 offered by Mr. Polis to require permission before information obtained from a wellness program can be sold. This is on H.R. 1313.
Mrs. Fox?
No.
Mrs. Fox votes no. Mr. Wilson? Mr. Wilson votes no. Mr. Hunter? Mr. Hunter votes no. Mr. Rowe? Mr. Rowe votes no. Mr. Thompson? Mr. Thompson votes no. Mr. Wahlberg? Mr. Wahlberg votes no. Mr. Guthrie? Mr. Guthrie votes no. Mr. Rokita? Mr. Rokita votes no. Mr. Barletta? Mr. Barletta votes no. Mr. Messer? Mr. Messer votes no. Mr. Byrne? Mr. Byrne votes no. Mr. Bratt? Mr. Bratt votes no. Mr. Grothman? Mr. Grothman votes no. Mr. Russell? Mr. Russell votes no. Ms. Stefanik? Ms. Stefanik votes no. Mr. Allen? Mr. Allen votes no. Mr. Lewis? Mr. Lewis votes no. Mr. Rooney? Mr. Rooney votes no. Mr. Mitchell? Mr. Mitchell votes no. Mr. Garrett? Mr. Garrett votes no. Mr. Smucker? Mr. Smucker votes no. Mr. Ferguson? Mr. Ferguson votes no. Mr. Scott? Mr. Scott votes aye. Mrs. Davis? Mrs. Davis votes aye. Mr. Grijalva? Mr. Grijalva votes aye. Mr. Courtney? Mr. Courtney votes aye. Ms. Fudge? Ms. Fudge votes aye. Mr. Polis? Mr. Polis votes aye. Mr. Sablon? Mr. Sablon votes aye. Ms. Wilson? Ms. Wilson votes aye. Ms. Bonamici? Ms. Bonamici votes aye. Mr. Takano? Mr. Takano votes aye. Ms. Adams? Ms. Adams votes aye. Mr. Desaunier? Mr. Desaunier votes aye. Mr. Norcross? Mr. Norcross votes aye. Ms. Blunt Rochester? Ms. Blunt Rochester votes aye. Mr. Krishnamurthy? Mr. Krishnamurthy votes aye. Ms. Shea Porter? Ms. Shea Porter votes aye. Mr. Espillat? Mr. Espillat votes aye.
Clerk will report the totals.
Madam Chairman, there are 17 ayes and 22 nays.
The amendment is not adopted. We now go to vote number 4, amendment number 5 offered by Mr. Polis to strike language that allegedly erodes GINA protection as it relates to the genetic information of family members covered under a plan and a wellness program. This is amendment number 5 on H.R. 1313. Clerk will call the roll.
Mrs. Fox?
No.
Mrs. Fox votes no. Mr. Wilson? No. Mr. Wilson votes no. Mr. Hunter? No. Mr. Hunter votes no. Mr. Rowe? No. Mr. Rowe votes no. Mr. Thompson? No. Mr. Thompson votes no. Mr. Wahlberg? No. Mr. Wahlberg votes no. Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Rokita? Mr. Rokita votes no. Mr. Barletta? No. Mr. Barletta votes no. Mr. Messer? No. Mr. Messer votes no. Mr. Byrne? Mr. Byrne votes no. Mr. Bratt? Mr. Bratt votes no. Mr. Grothman? Mr. Grothman votes no. Mr. Russell? Mr. Russell votes no. Ms. Stefanik? Ms. Stefanik votes no. Mr. Allen? Mr. Allen votes no. Mr. Lewis? Mr. Lewis votes no. Mr. Rooney? Mr. Rooney votes no. Mr. Mitchell? Mr. Mitchell votes no. Mr. Garrett? Mr. Garrett votes no. Mr. Smucker? Mr. Smucker votes no. Mr. Ferguson? Mr. Ferguson votes no. Mr. Scott? Mr. Scott votes aye. Mrs. Davis? Mrs. Davis votes aye. Mr. Grijalva? Mr. Grijalva votes aye. Mr. Courtney? Mr. Courtney votes aye. Ms. Fudge? Ms. Fudge votes aye. Mr. Polis? Mr. Polis votes aye. Mr. Sablan? Mr. Sablan votes aye. Ms. Wilson? Ms. Wilson votes aye. Ms. Bonamici? Ms. Bonamici votes aye. Mr. Takano? Mr. Takano votes aye. Ms. Adams? Ms. Adams votes aye. Mr. Desagne? Mr. Desagne votes aye. Mr. Norcross? Mr. Norcross votes aye. Ms. Blunt Rochester? Ms. Blunt Rochester votes aye. Mr. Krishnamurthy? Mr. Krishnamurthy votes aye. Ms. Shea Porter? Ms. Shea Porter votes aye. Mr. Espilot? Mr. Espilot votes aye.
The clerk will report the totals.
Madam Chairman, there are 17 ayes and 22 nays.
The amendment is not agreed to. We are now on vote number 5, amendment number 6, offered by Mr. Scott to remove the provision relating to the ADA safe harbor. The clerk will call the roll.
Mrs. Fox?
No.
Mrs. Fox votes no. Mr. Wilson? Mr. Wilson votes no. Mr. Hunter? Mr. Hunter votes no. Mr. Rowe? Mr. Rowe votes no. Mr. Thompson? Mr. Thompson votes no. Mr. Wahlberg? Mr. Wahlberg votes no. Mr. Guthrie? Mr. Guthrie votes no. Mr. Rokita? Mr. Rokita votes no. Mr. Barletta? Mr. Barletta votes no. Mr. Messer? Mr. Messer votes no. Mr. Byrne? Mr. Byrne votes no. Mr. Bratt? Mr. Bratt votes no. Mr. Grothman? Mr. Grothman votes no. Mr. Russell? Mr. Russell votes no. Ms. Stefanik? Ms. Stefanik votes no. Mr. Allen? Mr. Allen votes no. Mr. Lewis? Mr. Lewis votes no. Mr. Rooney? Mr. Rooney votes no. Mr. Mitchell? Mr. Mitchell votes no. Mr. Garrett? Mr. Garrett votes no. Mr. Smucker? Mr. Smucker votes no. Mr. Ferguson? Mr. Ferguson votes no. Mr. Scott?
Aye.
Mr. Scott votes aye. Mrs. Davis? Mrs. Davis votes aye. Mr. Grijalva? Mr. Grijalva votes aye. Mr. Courtney? Mr. Courtney votes aye. Ms. Fudge? Ms. Fudge votes aye. Mr. Polis? Mr. Polis votes aye. Mr. Sablan? Mr. Sablan votes aye. Ms. Wilson? Ms. Wilson votes aye. Ms. Bonamici? Ms. Bonamici votes aye. Mr. Takano? Mr. Takano votes aye. Ms. Adams? Ms. Adams votes aye. Mr. Desagne? Mr. Desagne votes aye. Mr. Norcross? Mr. Norcross votes aye. Ms. Blunt Rochester? Ms. Blunt Rochester votes aye. Mr. Krishnamurthy? Mr. Krishnamurthy votes aye. Ms. Shea Porter? Ms. Shea Porter votes aye. Mr. Espilot? Mr. Espilot votes aye.
The clerk will report the total.
Madam Chair, there are 17 yeas and 22 nays.
The amendment is not agreed to. The question now occurs on the amendment in the nature of a substitute. All those in favor say aye. Aye. All those opposed say no. No. The ayes have it, and the amendment is agreed to. If there are no other members wishing to speak on the bill, I'll now entertain a motion to report the bill and recognize Mr. Wilson.
Madam Chairwoman, I move that the Committee on Education Workforce report the bill, H.R. 1313, to the House of Representatives with an amendment and with the recommendation that the amendment be agreed to and the bill as amended do pass.
The question is on favorably reporting the bill. All those in favor signify by saying aye.
Aye.
Those opposed signify by saying no. No. The ayes appear to have it. The Mr. Scott requests a recorded vote. The clerk will call the roll.
Mrs. Fox?
Aye.
Mrs. Fox votes aye. Mr. Wilson? Mr. Wilson votes aye. Mr. Hunter? Mr. Hunter votes aye. Mr. Rowe? Mr. Rowe votes aye. Mr. Thompson? Mr. Thompson votes aye. Mr. Wahlberg? Mr. Wahlberg votes aye. Mr. Guthrie? Mr. Guthrie votes aye. Mr. Rokita? Mr. Rokita votes aye. Mr. Barletta? Mr. Barletta votes aye. Mr. Messer? Mr. Messer votes aye. Mr. Byrne? Mr. Byrne votes aye. Mr. Bratt? Mr. Bratt votes aye. Mr. Grothman? Mr. Grothman votes aye. Mr. Russell? Mr. Russell votes aye. Ms. Stefanik? Ms. Stefanik votes aye. Mr. Allen? Mr. Allen votes aye. Mr. Lewis? Mr. Lewis votes aye. Mr. Rooney? Mr. Rooney votes aye. Mr. Mitchell? Mr. Mitchell votes aye. Mr. Garrett? Mr. Garrett votes aye. Mr. Smucker? Mr. Smucker votes aye. Mr. Ferguson? Mr. Ferguson votes aye. Mr. Scott? Mr. Scott votes no. Mrs. Davis? Mrs. Davis votes no. Mr. Grijalva? Mr. Grijalva votes no. Mr. Courtney? Mr. Courtney votes no. Ms. Fudge? Ms. Fudge votes no. Mr. Polis? Mr. Polis votes no. Mr. Sablon? Mr. Sablon votes no. Ms. Wilson? Ms. Wilson votes no. Ms. Bonamici? Ms. Bonamici votes no. Mr. Takano? Mr. Takano votes no. Ms. Adams? Ms. Adams votes no. Mr. DeSaulnier? Mr. DeSaulnier votes no. Mr. Norcross? Mr. Norcross votes no. Ms. Blunt Rochester? Ms. Blunt Rochester votes no. Mr. Krishnamurthy? Mr. Krishnamurthy votes no. Ms. Shea Porter? Ms. Shea Porter votes no. Mr. Espelot? Mr. Espelot votes no.
Clerk will report the total.
Madam Chair, there are 22 yeas and 17 nays.
The motion is agreed to. The ayes have it, and the motion is agreed to. H.R. 1313 is ordered and reported to the House of Representatives. The chair notes for the record that a quorum is present. I now recognize Mr. Wilson.
I ask unanimous consent that staff be authorized to make necessary and technical changes to the bill in pursuant to House Rule 11, Clause 2L. I give notice that all members have the requisite number of days to file additional or minority views.
Without objection, so ordered. Before we move to H.R. 1101, I have an update. We have a few members who wish to have their votes recorded for votes they missed. This will be allowed provided these votes do not change the outcome of the vote. These members should meet at the clerk's table following the conclusion of today's markup. Updates to the vote totals will be posted on the committee's website. We now proceed to requested recorded votes on H.R. 1101. The question occurs on the amendment offered by Representative Davis. All those in favor will say aye. All those opposed will say no. The clerk will call the roll.
Mrs. Davis, Mrs. Fox?
No.
Mrs. Fox votes no. Mr. Wilson? Mr. Wilson votes no. Mr. Hunter? Mr. Hunter votes no. Mr. Rowe? Mr. Rowe votes no. Mr. Thompson? Mr. Thompson votes no. Mr. Wahlberg? Mr. Wahlberg votes no. Mr. Guthrie? Mr. Guthrie votes no. Mr. Rokita? Mr. Rokita votes no. Mr. Barletta? Mr. Barletta votes no. Mr. Messer? Mr. Messer votes no. Mr. Byrne? Mr. Byrne votes no. Mr. Bratt? Mr. Bratt votes no. Mr. Grothman? Mr. Grothman votes no. Mr. Russell? Mr. Russell votes no. Ms. Stefanik? Ms. Stefanik votes no. Mr. Allen? Mr. Allen votes no. Mr. Lewis? Mr. Lewis votes no. Mr. Rooney? Mr. Rooney votes no. Mr. Mitchell? Mr. Mitchell votes no. Mr. Garrett? Mr. Garrett votes no. Mr. Smucker? Mr. Smucker votes no. Mr. Ferguson? Mr. Ferguson votes no. Mr. Scott?
Aye.
Mr. Scott votes aye. Mrs. Davis? Mrs. Davis votes aye. Mr. Grijalva? Mr. Grijalva votes aye. Mr. Courtney? Mr. Courtney votes aye. Ms. Fudge? Ms. Fudge votes aye. Mr. Polis? Mr. Polis votes aye. Mr. Sablon? Mr. Sablon votes aye. Ms. Wilson? Ms. Wilson votes aye. Ms. Bonamici? Ms. Bonamici votes aye. Mr. Takano? Mr. Takano votes aye. Ms. Adams? Ms. Adams votes aye. Mr. Desagne? Mr. Desagne votes aye. Mr. Norcross? Mr. Norcross votes aye. Ms. Blunt Rochester? Ms. Blunt Rochester votes aye. Mr. Krishnamurthy? Mr. Krishnamurthy votes aye. Ms. Shea Porter? Ms. Shea Porter votes aye. Mr. Espelot? Mr. Espelot votes aye.
Are there any members who wish to change their votes? The clerk shall report the total.
Madam Chairman, there are 17 ayes and 22 nays.
The amendment is not agreed to. The question now occurs on the amendment in the nature of a substitute. All those in favor say aye. Aye. I was waiting, guys. All those opposed say no. No. The ayes have it. On our side, we got to drink some coffee or something. If there are no other members wishing to speak on the bill, I now entertain a motion to report the bill and recognize Mr. Wilson.
Madam Chairwoman, I move that the Committee on Education Workforce report the bill H.R. 1101 to the House of Representatives with an amendment and with the recommendation that the amendment be agreed to and the bill as amended do pass.
Question is on favorably reporting the bill. All those in favor signify by saying aye.
Aye.
Thank you. Those opposed signify by saying no. No. The ayes appear to have it. The ayes have it, and the motion is agreed to. The ranking member requests a recorded vote. The clerk will call the roll.
Mrs. Fox?
Aye.
Mrs. Fox votes aye. Mr. Wilson? Aye. Mr. Wilson votes aye. Mr. Hunter? Mr. Hunter votes aye. Mr. Rowe? Aye. Mr. Rowe votes aye. Mr. Thompson? Aye. Mr. Thompson votes aye. Mr. Wahlberg? Aye. Mr. Wahlberg votes aye. Mr. Guthrie? Aye. Mr. Guthrie votes aye. Mr. Rokita? Aye. Mr. Rokita votes aye. Mr. Barletta? Mr. Barletta votes aye. Mr. Messer? Aye. Mr. Messer votes aye. Mr. Byrne? Aye. Mr. Byrne votes aye. Mr. Bratt? Aye. Mr. Bratt votes aye. Mr. Grothman? Aye. Mr. Grothman votes aye. Mr. Russell? Aye. Mr. Russell votes aye. Ms. Stefanik? Ms. Stefanik votes aye. Mr. Allen? Aye. Mr. Allen votes aye. Mr. Lewis? Aye. Mr. Lewis votes aye. Mr. Rooney? Mr. Rooney votes aye. Mr. Mitchell? Aye. Mr. Mitchell votes aye. Mr. Garrett? Aye. Mr. Garrett votes aye. Mr. Smucker? Mr. Smucker votes aye. Mr. Ferguson? Mr. Ferguson votes aye. Mr. Scott?
No.
Mr. Scott votes no. Mrs. Davis? Mrs. Davis votes no. Mr. Grijalva? Mr. Grijalva votes no. Mr. Courtney? Mr. Courtney votes no. Ms. Fudge? Ms. Fudge votes no. Mr. Polis? No. Mr. Polis votes no. Mr. Sablon? Mr. Sablon votes no. Ms. Wilson? Ms. Wilson votes no. Ms. Bonamici? Ms. Bonamici votes no. Mr. Takano? Mr. Takano votes no. Ms. Adams? Ms. Adams votes no. Mr. Desaulnier? Mr. Desaulnier votes no. Mr. Norcross? Mr. Norcross votes no. Ms. Blunt Rochester? Ms. Blunt Rochester votes no. Mr. Krishnamurthy? Mr. Krishnamurthy votes no. Ms. Shea Porter? Ms. Shea Porter votes no. Mr. Espillat? Mr. Espillat votes no.
The clerk will report the total.
Madam Chairman, there are 22 ayes and 17 nays.
The ayes have it, and the motion is agreed to. H.R. 1101 is ordered, reported to the House of Representatives. The chair notes for the record that a quorum is present. I now recognize Mr. Wilson.
Madam Chairwoman, I move that the Committee on Education Workforce report the bill, H.R. 1101, to the House of Representatives with an amendment, and that the recommendation of the amendment be agreed to, and the bill as amended do pass. I ask unanimous consent that staff be authorized to make necessary and technical changes to the bill and pursuant to House Rule 11, Clause 2L. I give notice that all members have the requisite number of days to file additional or minority views.
Without objection, so ordered. And I want to thank everyone for your patience and courtesy today, and I particularly want to thank Ranking Member Scott for all his help in our procedures. The committee stands adjourned.